right, we're going to get started. Can you cut the music? Thank you. Good morning, everyone, and welcome to the Durham Summit on Saving Lives. My name's Ryan Smith. I'm the director of the City of Durham's Community Safety Department, and I'll be helping guide us through this morning. I want to start with a few housekeeping notes. One, this session is going to run straight till noon, so if you need to use the restroom, it is right across the hall. Please do so whenever that happens, whenever you need. And also, I'd like to ask you all to silence your phones during this conversation if you haven't done so. I'll give you a second to do that now. A lot of work has gone into getting us here today. Many people have participated across Durham in listening sessions. Many leaders have helped bring us to this moment. I want to kick us off this morning by welcoming up some of the leaders who have helped bring us together today. Mayor Leonardo Williams, Durham County Board Chair Dr. Mike Lee, and City Manager Bo Ferguson will prepare some opening remarks that help us bring focus to the purpose of why we are here today and what we hope to accomplish over the course of this summit. Mayor Williams, thank you.
Good morning, everyone. So we are finally here. It's been a long time coming, and over the next few days, especially today, some of you will say, oh, we've done that before, and someone else may say, oh, we've done that before. So there's going to be a bit of that, but everyone that says we've done that before, I seriously doubt that you've all done it together before, and that's what today is all about. There is so much experience in this room, and I can confidently say if we can't solve this issue and why we're here today, I don't know if it can be solved. There is so much brain power and experience in here today. That's what gives me confidence. So when I became mayor, this was one of the things that I was most excited to address because I felt, we had the people that can make it happen. But while politics is people work, politics is very, very complex. And everyone has an idea. And everybody knows the answer. But not everybody wants to work together. We've been resource rich for a long time. And we've been collaboration poor for longer. And so now, today, I've heard all of you. I've met with many of you, most of you actually. We've had conversations. And that's why we're in the room together today. And I want to thank, if I start calling folks out, then I'll get in trouble here. So I'm going to thank the group of folks that came and sat down in my conference room one day and said, we heard about this program. And that's how I met Dr. App. And one thing was for sure, we cannot outsource this problem. It has to be local. It has to be locally driven, locally facilitated. The stories of our folks here locally have to be told, and the work from our folks here locally have to be done. And so that's what we're doing. We're facilitating our local assets. So I want to thank all of you all that are here today. I want to thank my city council colleagues for being here and also being supportive. Please raise your hand. Council members Baker and Cook. And I'm sure the others are probably either on the way or will be coming. We're trying to dodge this quorum thing, but we're also on recess. But yeah, so welcome, and I'll just give a few remarks just to get us set. I know you're like, wait, what? Those were the remarks. Just want to welcome everybody here and just level set while we're here. This summit is our convening, and we have one singular urgent purpose, that is to save lives from gun violence. So our North Star is to identify and align around a set of actionable, evidence-informed strategies that Durham can begin advancing immediately to reduce community violence and start saving lives. I want to talk about what this summit is and what it is not. I want to be very clear about our scope. The summit is not the city's crime plan. It is not an attempt to solve every structural challenge that fuels violence. So we have poverty, housing, education, economic opportunity. Those things are very real and they matter deeply, but tackling them is not the work of this summit. Our charge here is much narrower and more immediate, saving lives that are at risk right now. And holding that focus is exactly how we make progress and how we can see and measure it. And focusing on the highest risk, to do that, we cannot rely on broad strokes. We have to understand precisely who is in Durham and who's at the highest risk of losing their lives to gun violence right now. And which specific strategies gives us the best chance of intervening successfully. By relying on hard data rather than anecdote, we can pinpoint the hyper-concentrated places and networks that drive most of the violence. That's not to devalue anecdotal data. We have that. We have qualitative and quantitative. We're going to bring all of that together in one space. The summit is the culmination of months of work, not the starting line. Over the past 6 months, we've held 18 community listening sessions across Durham with targeted outreach to youth, public housing residents, schools, immigrant communities, and formerly gang-involved individuals and survivors of violence. Residents told us that Durham is resource-rich and execution-poor, and that trust is paramount. Although our working group over the next few days is small by necessity, the insights, ideas, and concerns of Durham residents sit at the center of everything we take up here. So in the spirit of openness and civil debate, I'll ask one thing of all of us: come ready to listen as much as to speak, and be willing to disagree openly, vigorously, but always with respect. The strongest recommendations come from honest debate, not forced consensus. We can challenge one another's assumptions hard and still treat each other with civility and good faith. That is the standard we hold ourselves in this room. So I look forward to working with you all. You'll see Dr. Lee and I pop our heads in and out over the next few days. The room will get smaller as you all get to work around this table. My job as mayor is to empower the work that you do. It's on you all. Thank you.
Good morning, everyone. I'm really excited about being here. I'm excited about this milestone in this program. I didn't see any of my fellow county commissioners. Oh, there we are. There's Michelle right there. I didn't see them when I came in. But I'd also like to shout out the Board of Education. They don't have anyone represented that's going to be speaking like right at this moment. So please raise your hands or stand up. My Board of Education and future Board of Education member up there. I work at a place called Avalera, my real job. And one of the things we do in every single conference room, we have a orange statue, and it represents the customer. So that every meeting that we have, the customer is represented in the room. And so the idea here is each meeting that you go to, you click the light on, it turns on, it's a light. And every decision that you make should be based around the customer. It was the first company that I've been to that actually focused on the customer like that. So as this group begins, I would love to see a representation of the youth in the room, because every single decision, every single piece of data, every single decision that we're going to be carrying forward has to do with the youth. And I want them to be represented in the room every time. Now, I know physically it's probably not going to be possible, but just remember what we're doing here is about that. Every time we meet, it should be about that. Now, Durham's path forward depends on all of us. The city of Durham and the county are united in this effort. This partnership reflects a shared responsibility to confront violence with clarity, compassion, and proven solutions. Any of you who have seen any of my meetings know that I'm a measurement leader. It is about measuring progress and making sure we're moving in the right direction. But the complexity of this challenge demands a comprehensive approach. We must put together our invaluable local expertise and lived experience with national best practices, learning from cities who have successfully reduced homicides while tailoring those lessons into a plan that is uniquely Durham's. This summit is the convergence point where local data and community insights meet national evidence. This morning is about building shared public alignment. Together, we'll review Durham's specific shooting data to understand the local drivers of violence, hear the synthesized findings from our community conversations, and explore the core principles of evidence-informed violence reduction. Following this morning's public session, we'll transition into a focused operational planning phase. A dedicated working group of 30 leaders representing impacted communities, law enforcement, and support agencies will spend the next 2 days diving deep into the evidence, the data, and the community's mandate. Now, I want to be clear about this group's role. The working group does not have the final say. Its job is to translate the evidence and the community's mandate into a set of recommendations, a proposed Durham action plan that will bring our recommendations, bring our elected bodies and other community leaders, we'll bring it to our elected bodies and other community leaders. Those recommendations will be shared more broadly for input for anything before anything is finalized. In short, the work of these 3 days informs the decision. It does not end it. I want to close with something we've heard loud and clear and more than once from the people across the city. Durham is tired of being listened to. Residents have shown up to session after session, shared their pain, their wisdom, and asked us a fair and pointed question. What are you actually going to do? Today, we begin to answer that. This summit marks the turning of the page from listening to acting, from learning to accountability. The conversations are not over, but they are no longer the work. The work now is to honor what we have heard with strategies that saves lives and to hold ourselves accountable for delivering them. With that, let's begin.
Thank you all and good morning. I'm City Manager Bo Ferguson, and I want to start by saying how humbling it is to be in this room, to be surrounded by so many leaders of our community, leaders who have formal titles and elected titles, and leaders who have just been doing the work for as long as I've been in the city, since before I've been in the city, leaders who are at the table and leaders who are in the audience. It is truly humbling to be in the room with you and to know the importance of the work that we are doing today. I want to start by saying some thank yous. It took an awful lot of work to get here, and we have a lot of work before us. I want to begin by recognizing Duke Health and the Duke Violence Recovery Program. They have generously underwritten the cost of this summit, and I want to thank them sincerely for that commitment. It's a fitting way to begin because it underscores something true about all of the work ahead. Reducing violence in Durham will take many different agencies and organizations coming together, working together, and contributing what they can. Duke's partnership is exactly the model we need, and I hope you'll join me in thanking them for their support. I also want to thank the amazing county and city staff who have collaborated over the last year to research different models, to convene the listening sessions, to do the day-to-day work that it takes to understand what a path forward might look like, and to support the great leadership of our city and county leaders who have demanded that this be a path that our community goes down. I want to name specifically Crystal Harris and Rashana Humphrey from Durham County, and Ryan Smith, former Chief Patrice Andrews, and Interim Chief Tate, and all of the departmental staff in the city and the county who have helped bring this effort together. Summits like this don't happen on their own. They happen because people put months of quiet, careful work, and Durham is fortunate to have this kind of collaboration and leadership at our staff level. So please join me in thanking them as well. Chair Lee's comments emphasized the importance of city-county partnership. And I want to put a finer point on it from the execution side, from the management side. This work will only succeed when the city and county move as one. And I want to thank and name County Manager Claudia Hager for her steady commitment on the collaboration. She's had a personal commitment that has prevented her from being here today, but I want to let everyone in the room know that Manager Hager and myself are aligned, our teams are aligned, and that alignment is what will let us turn good ideas into coordinated action across every agency that this work touches. As Chair Lee also said, that group, this group will produce recommendations, not necessarily final decisions. My and Manager Hager's job and our team's job begin where those recommendations land. We're the ones who have to operationalize it and build the systems that track whether or not it's actually working. So I want everyone in this room to know that the recommendations that you shape over the next few days will not sit on a shelf. They will be carried into execution. We have a mandate to do that. We have a moral obligation to do that as a community. I understand exactly what this summit represents. It's a turning of the page from listening and learning to action and accountability. And I am personally committed to that shift, and I'm committed to coming back to the community, to our elected officials, and reporting honestly on our progress, whether it's easy news or whether it's hard news. And I think we all know with the difficulty of this subject, there will likely be some of both or a lot of both. That's what accountability requires, and I think it's what the people of Durham deserve. I know that city and county leadership at the administrative level and at the elected level are committed to that. So I think I close out the formal introductory comments this morning, and we get to start the work that I know you all came here for. I want to thank you again for your dedication, for your commitment to Durham, and for the leadership that you have provided and are going to continue to provide. I'm really excited about the results of the work that will lay before us. Thank you.
Thank you, Mayor Williams, Dr. Lee, Manager Ferguson, for your leadership, for your support in bringing us here today. I'm now going to, in a minute, invite up Thomas Apt. He's the lead facilitator of these sessions. He's going to walk us through what to expect over the course of the summit. Let me just give a very first brief introduction. For those who don't know Thomas, he's the founding director of the Violence Reduction Center, an associate research professor at the University of Maryland. One thing I want to underscore at the outset is that Thomas Apt and VRC, they charge nothing to the cities that they support, and we're grateful for that. It allows us to focus our resources where we need them most. Thomas and his team, as well as other national experts and local experts, have been advising city and county staff over the last year. We're grateful for Thomas and his team for being here today to help facilitate these discussions over the next 3 days. Thomas has spent his career advising on evidence-informed approaches to reducing gun violence across the country. Thomas, thank you for being here.
How embarrassing that would have been just to bite it as soon as I stepped up. It's a real pleasure to be here. It's humbling to be here. We at the VRC definitely want to meet the moment, and I just want to humbly thank Mayor Williams, Dr. Lee, Manager Ferguson. Those remarks couldn't have, oriented us better. So thank you so much for those remarks. Some of this is just going to repeat what they said. But in terms of the summit, let's talk about it. The purpose here is to align around a set of strategies that Durham can advance immediately to reduce community gun violence and save lives. Why are we focusing on community gun violence? I want to just answer all of the basic questions here first. Well, reducing such violence saves lives, it promotes justice, and it unlocks the potential of Durham's most impacted communities. Community violence is also the form of violence that is driving the vast majority of homicides every year in the city of Durham. Why are we focusing on evidence-informed strategies? Well, if you know what works and what hasn't worked from cities all around the country, and that's something that the VRC and our partners can provide, that's going to help you and enable you and empower you to make the best possible decisions for what is right here in Durham. What does immediately mean? What immediately means is at the end of the summit, as you heard, this group here, community members, law enforcement, service providers, advocates, activists, is going to make a set of very concrete recommendations, and those will go to our city and county leaders, who will act on them within 60 days. Again, it's important to set the scope here. This is not intended to be the city's overall public safety or violence reduction plan. It's focused on the form of violence that is costing the most lives to the city every year. So we're not going to be focused on other public safety issues. We're not going to be focused on family violence or intimate partner violence or bullying or other forms of violence. Those issues are extremely important. They deserve their own strategy. And so I just want to be clear about what we're focused on here. We're also not going to be addressing, at least directly, the broader picture, the root causes, the structural factors. Those too are incredibly important, but those are long-term issues which the city is moving to address in other ways, in other areas every day. Our focus here is going to be on saving lives and stopping violence right now. And again, then finally, we're not starting from scratch. As you heard, there have been months of listening sessions. There's been careful research. And what we hope is that the recommendations that come out of this summit will align with community feedback, also align with previous efforts and plans, so that we are consistent as much as possible with those previous efforts and strategies. A little bit about us. Our full name is the Center for the Study and Practice of Violence Reduction. It's very wordy, but I like it because it actually describes what we do. We study and we practice. Our role here is to facilitate. Our role is to present you with information. Our role is not to make decisions. It's the working group here that is going to make the recommendations to our elected officials, but we hope to be useful in terms of providing you with the information you need and also keeping you on track and keeping focused. We got started, we're young and small but mighty. We started in November of 2022. We're located at the University of Maryland at the College Park. And our goal is to offer solutions to community violence by combining rigorous research with practical know-how. On the study side, we review rigorous research, we synthesize it, we organize it, and we make it available to policymakers and practitioners in accessible, easy-to-use formats. On the practice side, which is what we're focused on here, we provide practical instruction to cities on how to choose the right combination of strategies that's right for them, that's customized for them. We are formally engaged in Knoxville, Boston, and St. Louis, and Memphis. A month after this practicum, we'll begin with Atlanta. A month after that, we're going to begin in New Orleans. And we've informally advised hundreds of policymakers and practitioners at the federal, state, and local level. As Ryan noted, everything we do for free. Our research there's no gatekeeping. Our research is available on our website, and when we work with cities, we donate our services. And so I want to point out that there's a mutual selection process. You have selected us, and we're deeply grateful for that. But we chose you as well. And we chose you because we think that together we can advance our mutual mission of saving lives. We see tremendous opportunity in Durham right now, and so that's why we're here. Just a little bit about the actual numbers. Is what the VRC is doing. We don't have a formal evaluation yet. We still need to add a few more cities before we do that. But it's important to look at the data. And what you see here is a very crude comparison. This is a comparison between how the VRC cities are performing since they had their summit or practicum or began their engagement, compared with the national averages. As you may know, violence around the country is falling. So it doesn't mean much to say that in every VRC city, violence is falling. That just means that we're performing on average. But what you can see with these comparisons, the yellow line is the VRC city, the blue line is the national average, is that every city is outperforming the national averages. On homicides, actually, 3 of the 4 are. St. Louis, both the city and the county, are reducing homicides, but not by quite as much as the average. But our other 3 cities, Boston, Knoxville, and Memphis, are. And all 3 cities are outperforming in terms of non-fatal shootings. We are in the planning stages for a formal evaluation to drill down because we believe in holding ourselves accountable. But this is a crude indication that the VRC is helping these cities. Of course, at the end of the day, it's the folks in Boston, Knoxville, Memphis, and St. Louis who are driving this work, just like you will drive the work. But our hope is that maybe the VRC makes you a little bit better at what you do. So back to the summit. What are our goals? Number 1, we want to engage with the feedback that we got from the community listening sessions. We want to understand community violence based on a rigorous problem analysis. You're going to hear about that shortly. We want to learn about past, current anti-violence efforts in Durham. We want to learn about new strategies for reducing community gun violence. We want to, very importantly, as the mayor said, increase collaboration around reducing community violence, and we want to reach consensus on a set of strategies. How it works. Here at the summit, after the end of this session, we'll break for lunch and then convene. Working group members are going to learn about the theory and practice of violence reduction and about the evidence behind specific strategies. And they're going to hear that evidence, they're going to deliberate, and then they're going to draft an action plan with recommended strategies for our local leaders. And then after the summit, those leaders are going to think about those recommendations, consult with additional people, and then ultimately release an official action plan within 30 days. And then immediately, planning and implementation will begin. And the VRC is going to be with you every step of the way. We were here, several months ago, and we're going to be periodically back. We're also going to be in constant contact via Zoom and email and those things as well. So this is obviously our agenda for today, but I also want to give you a sense of what the working group is going to be talking about. So this afternoon, we're going to start with specific strategies. We're going to look at the focused deterrence gun violence reduction strategy. We'll look at street outreach interventions. We'll look at prevention, intervention, and recovery services, especially those that feature cognitive behavioral interventions. Thursday is jam-packed. We'll begin with place and problem-based policing. Then we'll talk about environmental crime prevention, all the ways you can change the physical and social environment to reduce crime. We'll talk about how to police and prosecute gun violence. We'll talk about the general management strategies for anti-violence initiatives. We'll talk about how to fund them as well. We'll talk about the importance of procedural fairness, voice, inclusiveness, neutrality in all the work that we do moving forward, and then we'll start planning. And then Friday is dedicated to planning and ultimately to crafting those recommendations. I'm extremely excited about what's ahead. I hope you are too. And with that, we'll move to the next session.
Thank you, Thomas. So as we have said in some of the opening remarks, today isn't the start of this work. We have been working hard as city and county staff over the last year. A lot of that work has been listening to residents across Durham, understanding their lived experiences of gun violence, understanding the strengths that we have to build upon, understanding the gaps that people see. We want to start, I love the story you told, Dr. Lee. I'm just going to remind you all, Dr. Lee talked about, at his place of work, they begin every meeting with this orange statue. They turn the light on, and it helps them focus on the customer. We are kicking off this summit in a similar way. The very first session, we're going to turn on that orange light, but that light is about Durham residents who are living with gun violence every day. We have spent time over the last 6 months engaged in a lot of deep listening and learning, and we want to start to focus our attention and to build on the foundation of the lived experience of Durham residents who live with violence, who have hopes of what we might do in this space to really center that work, to center their wisdom, to center their expertise. I'm going to invite Roshana Humphrey, who's been one of our partners in this work. She is the director of Durham County's Justice Services Department. Justice Services Department does a range of important work, working with justice-involved individuals, working on mental health needs, reentry, diversion. Roshana's been a critical leader working with Crystal, myself, and others to help organize these. Roshana will now come up and share a summary of what we have learned over the course of the last 6 months in conversation with many people. And I want to say one other thing, Roshana, before is the city held a bunch of listening sessions. I also want to thank and acknowledge and recognize there were other groups who organized their own sessions. I see some of you here today and invited us to attend, and we did. So there was both the work that we did and the work that others convened. And so I just appreciate many people's commitment, many people showing up to share over the course of this last 6 months. This is the place we begin. This is the foundation we build upon. Thank you, Roshana.
Good morning. As Ryan mentioned, I am Roshana Humphrey. I'm the director of Durham County Justice Services Department, and I'm excited to be here this morning kicking off the summit. I know we were tired of listening, but one of the things that will shape the work that we do moving forward is to show you all what we heard. So we're going to listen just a little bit more so that you all will see where we're starting at. So let's see what we heard when we had these listening sessions. So as Ryan mentioned, and a few others, for the last 6 months, we have been working with the community on providing listening sessions. So we started in January and we went through May. We had 15 plus, 18 to be exact, listening sessions out in the community, where we really shape those sessions to hear from others. We didn't go there saying, this is what we're going to do, this is what we want to talk about. We went there saying, we want to hear from you. And those sessions were very well attended, and we gleaned a lot of good information. We heard from hundreds of residents. They shared their ideas. They also shared many concerns, which we wanted to hear. We wanted to hear about what the concerns were. And then as we went through and gathered the information from the sessions, 8 themes arose as we went through those sessions. So, a cross-section of what we heard as we went through those sections. We talked with public housing communities. So we went out, we talked in the public housing community. We also talked with Durham Public Schools. We heard from counselors, we heard from teachers, we heard from social workers about their experiences in Durham Public Schools. We also had a session with young people. Project Bill, one of the county's major programs, we talked with them. They hosted a session for the youth that they work with. We talked with residents with lived experience, formerly gang-involved residents. We heard from them about their experiences and their concerns. We also spoke with Spanish-speaking and immigrant families. So we wanted to make sure we were very inclusive as we went around and hosted these listening sessions. We also talk with survivors, faith-based leaders and organizers. We talk to families that have been touched by violence. We wanted to hear about those experiences and what they wanted us to know, what they wanted to see as we move this initiative forward. So this is just a depiction of all of the types of groups that we included in the listening sessions. This is the through line of what we heard through all the listening sessions. By the listening sessions and what we gathered, we heard that Durham is resource rich. You heard our introductory speakers talk about that. Resource rich, but execution poor. And we understand that. We own that. And that's one of the things we're going to address, that we need to have better execution and coordination of our efforts as we move forward. And throughout this presentation, you will see, and I will read for you, I'm not going to read all the slides to you, but I will read the resident comments because I think it's very important for you to hear from the words of the residents exactly what we heard. So residents describe hundreds of programs working in parallel, often unaware of one another. And we know that. We know we have plenty of programs out here, but sometimes we don't know they exist. We have one program working in one area, we have another program working in the other, both possibly doing great work. But we need to bring those together so that we can have the better bang for the buck and the better impact on the community. While people were at the highest risk of fall through, we had these programs that were not working together. The diagnosis matched the data. Durham does not mainly need more programs. It needs to focus, coordinate, and sustain what it already has. So that's what we're focusing in on. We want to look at what we currently have because that's very, very important. We don't have to start from scratch. We have a lot of great things going on in the city of Durham, the county of Durham. So, the 8 themes that came out of these listening sessions. The first, a small number of people and a handful of places. That's one of the themes that we saw. Second theme, credible messengers and the window before violence. And I'm going to just hit these, but I'm going to dive deeper as I go forward in the slides. The third thing we saw, changing minds means meeting the need for income. The fourth thing, safer places. We need light, blight, housing, and movement. The fifth thing, trust, fairness, and legitimacy. Very important. 6, healing after the harm. We very rarely talk about that. It's so important. Healing after the harm. 7, the schools and the youngest residents. And then 8, coordinate what Durham already has. So these are the themes that we're going to dig deeper into. So that first one, a small number of people and a handful of places. What are we talking about here? Residents were clear that violence is not evenly spread. They asked Durham to concentrate on the few people and the few places that's driving this violence, to focus rather than to dilute, and to lead with help, reserving enforcement for those who really need it. So let's look at the comments that were given by the residents. A small number of people that are either victims or main perpetrators of violence, and you work directly with them. That was an ask for us to work directly with those individuals. The next quote, target the leaders of gangs for good things, not just to bust them. So how can we work with those individuals directly? And then the third quote here, give them the talk, the resources, but for those who refuse it, that is where we do enforcement as a key part of the solution. So offer resources first. So this is on that first bullet of small number of people and a handful of places. These were some of the comments from residents about how we address this particular theme. The second theme, credible messengers and the window before violence. So what we know, there's a precise moment to intervene. We got to get there early. We got to get there early. We tend to get there a little bit after, but we know we need to intervene earlier. Well before an arrest or shooting, we need to make sure we're intervening. And who does the intervening matters. That's what we talk about, credible messengers. Who does the intervening matters as much as when it happens. Intervening happens, but we also need to make sure the person that's intervening is a credible messenger. And then the last thing residents pointed out was around a community-based outreach like Bull City United. So some of the resident comments. You hear his name before he becomes a target. That is the time to intervene. So that's that early intervention, and we all know we've heard it. We've heard individuals' names in the communities all the time. This one is the one that's responsible. This one is doing it over here. This one is doing that. So if we have the name, we need to intervene early with those individuals, and not just to bust them, but to offer them resources. Bring the OGs in to speak to the younger generation about the real dangers of gangs. So again, if we know who the individuals are, let's work with them to utilize them to be a part of the solution and not a part of the problem. And then the third quote here, I made it out, but only through community outreach. People saw more in me than I saw in myself. So, being that enforcement for individuals that want to change and encouraging that change. The third thing we saw, changing minds means meeting the need for income. So you can't just tell people we want you to change, but we don't have any alternatives for them. So we need to meet that need for income. Residents described a real desire to change colliding with the immediate need for money. We all know that. Programs that ask people to wait or to pay too little to live on lose them. They refrain with jobs, 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 especially for people whose records, especially for people with records or for who want to leave gangs. And so what we're meaning there is that you have to offer solutions for individuals. You can't just say we want you to change or we want you to go out here and get a job. We have to assist people in getting to the resources that are there or providing the training necessary to get the jobs that we keep saying, jobs, jobs, jobs. So again, quotes, jobs that will take more chances on people and not judge them because they look a certain way. We need to help them find those jobs. Parents work multiple jobs, so kids are left alone in the streets. They, gang-involved youth, can't wait 3 weeks for a paycheck. They need something right now. So we need to help people get to that immediate employment that will lead to immediate money. Safer places. Residents are tired of the conditions in their surrounding. They need lighting. If we go to neighborhoods and we see that the lights are out, things are broken, everything is run down, that's not a good look. And so they talked about that. They also talked about the need for housing, stability, and transportation. Cornwallis residents spoke a lot about this and very vividly about the need to improve the environment in that area. Some of the quotes, grass has grown up higher than my chest. Lighting everywhere, clean up the trash, fix the broken windows. And we've all heard about the broken windows theory, fix the broken windows. One comment was that shot spotter was perfect if we don't get anything else back. So they're talking about things that they felt helped them, that they want to see us take another look at or dive a little deeper into. The fifth thing, trust, fairness, and legitimacy. Very, very important. We heard this at all of the listening sessions. People need to feel like they can trust the individuals that they are working with. That is critical to this. More than any program, residents cared whether the system was fair, responsive, and theirs. And by theirs, it means they wanted to feel that ownership. They wanted to be a part of it. And that's so important. Procedural fairness, language access for immigrant residents, and genuine community participation will determine whether or not this will work. People want to feel a part. They want to be a part. They want to be heard. Trust has eroded to inconsistent engagement and follow-through. We have to follow up. If we say we're going to do it, we need to do it. One of the things you saw in the summit goals, you saw time frames. You saw that things will happen, 90 days, 60 days. That's what we need. We need that level of accountability. We're not just going to talk and have you listen. We're going to follow through once the summit has ended. More quotes. You cannot be successful in addressing gun violence without trust. We need police officers who can speak our language. Again, people are telling us what they need. We have to be responsive. Healing after harm, so important. What are we doing to support individuals who have experienced the violence? Residents described a shortage of support after violence. Nowhere to take their grief or struggles. No assistance to pay for funerals. for individuals and families affected by violence, there are a few places to turn to for support, healing, and recovery. They praise programs like Duke's Hospital Violence Intervention Program and also the Office of Survivor Care, and ask for healing to be brought directly to them in the neighborhoods. So we have to be responsive and listen to what's being said, not just having offices that are available, but actually going to where people are that need that assistance. So quotes here for healing after harm. One resident said, "My baby cries because he doesn't know why he was shot." Many who commit violence have survived violence themselves. Nobody reached out to me when my relatives were shot. After every incident, we need to send out trauma teams. So again, we're hearing, what is the need? What is the need? Schools and the youngest residents. We heard earlier about the need to actually include young people in the conversation. Educators see schools as one of Durham's strongest prevention assets, but it's also stretched too thin. They name social emotional learning and restorative practices as something that's very important and ask for real mental health capacity at that school level. So some of the quotes here are, if they are coming to school, they are at least not engaging in violent activities. Talk to kids about mental health. I deal with depression every day because of my environment. Create a sense of belonging so students have trusted adults. So when there's a problem, they can communicate to that adult. Again, you see that theme of trust, not just with our older residents, but also that theme came out at the school system, that they need to feel that they can trust the adults. So trust is very, very important. Coordinate what Durham already has. I spoke in the beginning about us being resource rich, having programs that work, so we need to coordinate that. So the loudest theme returned throughout is that effort without coordination. Residents called for a central, accountable office with a real budget and for protecting programs that live and die by their championing. So, quotes here, we have the ecosystem, but we need the structure. So again, another thing we're hearing is that structure that is needed. I'd like a countywide person to help all nonprofits know about each other and build strength out of the sum of the parts. So we got to know what's going on. We need somewhere to understand who's doing what and how we can work together. Hundreds of groups are out there working, but groups don't know what each other are doing. If we can get people to connect, we can synergize the energy and become more coordinated. So people are asking for coordination. A lot of times we hear groups don't want to work together. They don't want to work together, but sometimes they just don't know how to work together. So we have to provide that mechanism to help people with collaboration, to understand that collaboration is a win-win situation. So, 6 things residents asked for out of the summit. Focus on a few, because you heard about the small number of people, small number of places. So they asked for us to focus on a few. Concentrate on the small number of people and places that are driving the balance. Don't spread the work so thin that it doesn't have an impact. The second thing that was asked for was to lead with support. Reach people before crisis through credible messengers, and we heard that again, credible messengers, pair change with real immediate income. The third thing they asked for, invest in what works. So let's sustain and protect programs that keep residents safe. So we want to hear about the things that are working because we want to invest in those things. Fix the places. Invest in lighting, cleanup, open public spaces, housing and transportation where the risk is highest. So, earn trust. Emphasize fairness, language access, transparency, and community participation at every step in the process. So not just here in the beginning, but every step in the process, we need community participation. Very, very important. And build the engine. Stand up a central, accountable, coordinating mechanism so the city and the county can point assets in one direction. So we're not just asking programs at the community level to work together. We're saying the city and the county, and you can see, are committed to working together already. So we're committed to it. So we have to put our assets together and point all that in the same direction. So, the work ahead, from resource-rich to execution-rich. This is where we're headed. We know we have the resources, so now we need to execute. The work of the summit is to make Durham execution-rich, as well as with focus, balance, and above all, the fairness that will determine whether any of it is believed. That's the most important part, because it has to be believable, and that goes back to that trust factor. So, I will read this because it's important that we thank the people for the great work that's already happening here in Durham. So, with gratitude to the residents who shared hard and personal truths, and to the partners who opened doors or hosted their own community sessions, excuse me, including but not limited to Haiti Reborn Justice Movement, Project Bill, the Durham Housing Authority and Cornwallis Road residents, Durham Public Schools, El Centro Hispano, Connie Aban Bermudez Bay, Grace Inc., Durham Can, and Faith Community Partners, the Office of Survivor Care, among others, and the community groups who jointly hosted the annual Youth and Family Forum for Gun Violence Prevention. Also, a special thanks to Shayla Dushayla, the Bellwether Collaborative for Health and Justice at Duke University, and to the Vera Institute of Justice who supported our community learning work. So we thank everyone who has participated thus far in helping us to get to this point. It's very important. We feel like going through what we heard at the listening sessions was very important because it helps you to understand where we're starting. We're not starting from scratch. We're starting from listening to what the community has told us they want to see. And we feel like that is crucial to this effort. Thank you so much.
So we're going to take time now for questions. So what I think we're going to do is, yep. You have questions, comments, anyone in the room? We have about 30 minutes for an open discussion focused on the presentation. We also have a mic in the back, so please raise your hand if you have, yep, great. Raise your hand if you have a question or comment.
Mic check, mic check, mic check. Good morning, or good afternoon, whatever time it is now. My question is around, as we continue to execute the plan and develop a way to address immediate needs, I'm also curious about what you mentioned earlier about root causes. I'm really thankful that we mentioned a name, that we're not going to talk about it during this session, because that's real. But we do need to talk about it and figure out how and when and why and all of those parts. So I just want to figure out what does that look like? Have y'all talked about that? Because it's, can be a little hypocritical and performative if we're not careful. Really slippery slope.
Yeah, I think it's a great question, and it comes up in every city that the VRC engages with, and it's a really difficult question. But one thing that I have found, in the course of doing research, but more practically when I was doing this work on the ground in government, is if you promise to do everything, you're most likely going to end up doing nothing. And we have to be realistic about where we can start. And I think one thing that we often don't think about is, there is an ugly history in this country of racial persecution that created concentrated poverty and racial segregation over generations that produced social dysfunction, and that's why we're here today. And that's a very important story to understand, and it is part of this nation's mission overall to slowly unwind those things. But that pathway is also working in reverse, meaning that high rates of violence are traumatizing communities, intensifying racial segregation, intensifying concentrated poverty, and ultimately reinforcing social stigma and separation. And so our goal here is to work on it in that direction. And I think it's important to understand, you know, myself as a citizen, other folks here at Durham residents, you need to be able to do many different things. But within the violence reduction space, you need to stay focused on the violence. I hope that's responsive.
Thank you so much for the presentation and sharing kind of where the residents are at. I did have a question around this concept of resource-rich to execution-rich. And I know in the presentation it was spoken about of essentially needing a person or almost a new position to basically bring all these resources together. So my question back is, will there be a new position, either city or county, or should that be housed outside of city, county, in a nonprofit or other organization?
Thank you. I'll start with that one. So one, what we were presenting today, what we started off with were in the words of Durham residents, a variety of different things that we heard. We are not at the place yet in this summit where the working group has had a chance to convene and talk about various aspects. You saw there's a session around managing partnerships, for example. Managing and coordination is likely a very critical part of this work, but exactly how we do that and where that lives are still things that we need to discuss. So putting that quote up there is not to suggest what that solution is, that it would be a single staff person that sits in the city or county, but I do think this theme of management and coordination is really important, and those are things that we are going to talk about as a working group and really dig into. I hope that answers the question.
Good morning, everyone. Thank you for this presentation. This is very enlightening. And the question I have, I was listening to the presentation, the listening session, the feedback, and it was brought up that there were residents who thought ShotSpotter was a good thing. But yet, I know my colleagues on the city council, it got voted down. So I'm curious as to find out, because I think sometimes there's a disconnect between what we do as policymakers, as elected officials, and are we really listening to the residents and about what they need? So I'm curious to find out, why did they think that was a good thing and how it helped with violence prevention and things of that nature?
And I don't know that we can speak to specifically why the resident did that, but as we went through the information we gathered, we talked about various programs, and I think that was just one of the programs we highlighted in the quotes, but that was not the only program that was indicated as something that they felt like we should keep because it worked. And so in looking at that, that's one of the themes we wanted to bring out, is that we have programs that residents feel like they work. For whatever reason, they may see it on the surface as working, but we will dig a little deeper as the work group starts to look at what people said worked. We'll dig deeper into, did it actually work, or why they felt that way, and how we might be able to do something, if not that, something similar to that, to bring it back.
And I want to add a little bit more to that. So, I do want to say that we heard differing opinions on ShotSpotter in our listening sessions. But I also want to say, and this was a conversation that Mayor Williams and I were in at Cornwallis Road, that in some places where violence is very focused, one of the real themes that came out, and Mayor Williams, you can correct me if I get this wrong, but when we were at Cornwallis, the residents, one of the real themes they lifted up was they felt safer when ShotSpotter was here than not. That is not, I do want to just fairly represent what we heard from residents. We also heard residents at other sessions who were concerned about other things that we know that have been talked about with ShotSpotter, over-policing or surveillance. But there were residents, especially in some communities where there have been higher rates of gun violence, who wanted that or something like that back. There may have been conversations about improving lighting or adding cameras or other things like that. So this is an accounting of what we heard. It is not to, I do want to note that there is, as everyone knows, divided opinion in Durham on that. I don't know, Mayor, you want to add anything else, but.
Not really much to add, just that, you know, we are really setting in, pardon me, really setting in that, you know, this came from the residents, so you're going to hear a lot of the concerns from people who are living in the experiences, and part of this work was going to where the residents are. Not every resident is going to have the luxury of coming to City Hall or coming to the commissioner's chambers. So you're going to hear a broad swath of opinions. I want to be very cautious that we're not even at the policy stage yet. You know, even just I don't want to even keep saying shot spotter, because it's not about just that one program. It's about what the resident felt, and I want to lift up how they felt. But the idea is to get to the policy stage, which could be shot spotter and a whole lot of other things, or it could not be that. But policy is going to be shaped around the work that is put together from this working group, and whatever that looks like is what we'll know in a couple of days, and we have 60 days to get that to work. As an elected official in this space, my goal is to just shut up and listen and empower the work that you all do around this table, the working group, and be informed continuously by the community. When it gets into political space, it gets really murky. And one thing I'm tired of is we're governing on assumptions or governing on very narrow agendas. So this is the broadest approach that we have ever taken, and the most aggressive and assertive approach to solving this issue. And it's going to look really different to a lot of people. So that's a lot of words to say we're still listening and recommendations are going to come. And in regards to questions at this time, I'm just going to keep it resident focused, community focused, and less about us. Thanks.
Good morning. My name is Larry Thomas. I am with Thomas Mentor Leadership Academy here in Durham. And I just want to thank Dr. Lee for mentioning the youth and having the youth in the room and hearing their voice. Since 2010 up until 2025, we have been tracking the number of youth probably from the ages of 7 to 17 or 18 that have come in contact with law enforcement. And we don't know what the case has turned out to be, but just come in contact with law enforcement. And it's been like over 9,000, right? From 2010 to 2025, it's been like over 9,000. So, and I hear the community conversations in the listening sessions. So in the community conversations, have there been community conversations with just youth? And what have they been saying? And what Dr. Lee saying about having them in the room, what's the plan to get them in the room as we move forward?
So I'll speak to that. So we did have a specific listening session with participants from Project Build. We've also had some listening sessions where Grace Inc. actually had a youth conference. And so we've talked to some youth, and some of the comments up there were from that youth session that we had. And so we know that we have a lot of programs for our youth around prevention. And so as we said in the beginning, this is just the beginning of our work to be done. And so if you're not at the table in the working group, does not mean that we will not call on you to be a part of the next step. everyone can't be at the working group, because we know as you get larger and larger, you kind of lose focus. And so we wanted to make sure that we have steps and phases on how we do this work. So we will continue to engage our youth in this conversation, because we know that there is a place that we have to do some prevention and intervention with young people. But as we go to our next presentation, I want you all to kind of hear from our data and what that looks like, because we again are focusing on our highest risk, and the data might be a little interesting to some and new to what you think is going on in our city. So we're definitely not negating our youth. We are including them just as much as we're including our residents who are in the neighborhoods. The youth are at the center and the focus of this conversation as well.
Yeah, I'm Willis Reginald Hart Jr. I'm a sixth-generation Hart from Stadtville Plantation. And I had a question for Dr. Abbott. You said racism, segregation, concentrated poverty, crime and violence, that's the phases that it goes through, and it would happen to any community if you was put in that situation. So by Durham being in that situation and us being in segregation, it was gonna happen to us anyway. So who do we got that has the juice that can get in the streets and do the outreach, that know about what's going on? Who do y'all have to do that? Because if you don't have that, you're not going to get anything done, because they don't trust law enforcement. They don't trust the system, because they've been beat up for so long. So how we going to get it done? Who you going to put in the street with the juice?
It's a great question. You know, one of the things you see with the strategies that work best in terms of delivering supports and services is you got to have that juice. Folks call it license to operate, folks call it credibility, folks call it a million different things. But what you see is the organizations that do this are employing people with credibility with those communicate studies, so that they can say, look, this program can make a positive change. It made a positive change for me, it can make a positive change for you. Look, I know you're not interested in talking about all your problems or whatever, but I did it, it really helped me, those things. So if it's just, well, we've got the members of the working group, we've got all of these folks here, and we're going to have to build that out slowly but surely and find those folks. And it's not everybody. You know, not everybody can engage those who are at the highest risk, but we're going to need to find the people who can do it, train them appropriately, resource appropriately, because they're incredibly important. Great question.
My name is Lori McAdoo, and I just want to say thank you. Thank you all for coming together. Thank you for this mass of information that we have in here as we try to move forward to do better for the city that we all live in. I'm not an original Durhamite, but I've been here 32 years, so that's good enough to know what's going on today. And what I want to impress upon everyone in the room is the lack has not been the resources, the lack has not been the love, the lack has not been the need. The lack has been the communication. The lack has been the trust. And true communication gains trust. So we're looking for the next phase to come with some powerful numbers, but tell the truth in the numbers. We can digest what you give us, just give us something digestible. And we will use what we have to get where we need. There's people in here on every aspect that can help. I'm here on the foster care part. I was a foster child at 13. I graduated from college. But I also was homeless 2 years later because that system dropped me. And so I'm here from that part of the system. I'm your foster care lead. There's people I see here that are at the same meetings, from Contaminated Park, from the PERC team. We all are the same people and the same faces pouring out of the same pool with the same love in our hearts. Get us the information, but get us the positions as well. You get paid for it. We do it from love. We're not asking for your money, but we're asking for you to give us the time, give us the space that we can go make our money and come back and love our community. We all can't come in here on these types of meetings and make it. I'm retired. That's why I'm here. I probably should have been at work if this had happened. So let's share it equally, share it with the people who can get it to the folks that need it. And for this turnaround, let's make sure this time we are truly working together. Thank you.
Good afternoon. My name is Kevin McIver. I'm the chairman for the Durham County Juvenile Crime Prevention Council and also work for the Department of Health and Human Services for one of our state psychiatric facilities. My question to Dr. Abbott is, what is your turnaround when it comes to doing your statistics and also keeping up with your consistency with your meetings? Because one thing we understand in our community is the consistency and the time periods between the different meetings and being able to keep up with the data-driven parts of it. How often are you meeting with your other cities in order to come back to the table to see if it's really truly working, and what timetables do you give them to see if the numbers start to differentiate and change?
Sure. Well, the working group is going to decide the precise sort of rhythm and sequence. But in other cities, generally speaking, you've got sort of at least two sort of tracks. You've got the sort of operational track that is really tip of the spear, engaging high-risk people in places, both with services and supports, and if necessary, sanctions. And that group is usually meeting weekly, at least. And so that is sort of almost real time. But that's a small group because that group has to be very highly coordinated. And then there's usually some kind of higher level strategic group, advisory board, something like that, often chaired by electeds. And that's often meeting at most monthly, at least at the minimum quarterly. But that meeting is usually public, and it's usually sort of a public accounting of, going through the numbers, going through the metrics, what have we done. It's an opportunity for the electeds to hold all the operations people accountable, but it's also an opportunity for the public to hold everyone accountable as well. So that's usually the pacing. I don't know what folks in Durham are going to decide, but it might be something like that. But they'll decide.
It's Tanya Kelly, and I'm a resident of Cornwallis community. And something was said about bringing in the trauma team, the people, immediately. You can't just bring them in one time and not continue, because most times when you live in communities like ours, there's retaliation. So you gotta keep coming. You gotta try to de-escalate. Like, there's a lot of people, once a shooting happens, they don't come out their homes. So there's a lot of needs that are not met. Like, if we giving out diapers and stuff like that in the community, they don't come. So this is when we supposed to be able to talk to somebody in the community, find out who's not coming around, who's not coming out there, because most times it takes y'all so long to pick up the dead body. You see what I'm saying? The children done watched it for so long outside. There got to be some kind of decency, like cover that up, so the kids, because they go to school and they talk about, because I hear my grandkids say, the little kid at the top of the hill said they saw this, and this. So it doesn't affect just that person that got shot or their household, it affects the whole community. So in order for us not to keep having the one shooting can lead to 10 retaliation shootings. So that's where we got to come in at right there on a continuous basis until you see everything's calming down. But then you got to watch that, because sometimes it calm down. That's just the little act, before the real thing happened. But you have to come in and utilize the people that are not getting paid. Utilize the ones that feed the community, that the kids come and say, tell us all the business. We know everything. Utilize us. We utilize the people who are willing to cry with the people who help wipe the blood up, because y'all don't clean up the blood, y'all just leave it. So the children, look at that, like, you see what I'm saying? So these are things that we see on a continuous basis. Then we have to ask housing, hey, can y'all come clean this up? They're already short staff on the maintenance of the inside of the apartments. You see what I'm saying? So we're not helping each other by just doing the common decency things that we need to do. Keep bringing these people in until you help the people, till they come out their house, till they're able to let their grief out, because some people are so scared they're not gonna talk to you the first day. They don't wanna see no trauma team the first day. They don't even know what to think. Keep coming until somebody comes out. Keep coming and loving on that community. Find out what that community needs. Back the community, the leader that's trying to help the community, back them so they can, because we know what's getting ready to happen. So we try to do things to bring the community some joy for just that one day. We can meet the food need, the hygiene need, there's some kind of need. That brings down a lot of violence, because when a family going through, the person, the breadwinner might have been shot. The person who might have been doing the wrong thing, he might have been shot. What they gonna do? Now mama may have to do something strange for a piece of change. The kid's still in the same situation. You know what I'm saying? So we not really getting to the problem what's really going on. These kids are growing up angry. They mad at everybody. You can't tell them nothing. So we can have all the meetings we want, but if we don't utilize the people who know what the tears these kids cry, who know how to, I can't get no rest at my house because they knock on the door. You got any sandwiches? You got any can? I got to give up something, because I know for you to have to come from where you was at to my house, you had to be hungry. Some people don't have income. They using their food stamps to get by. We can't, I can't say nothing about it, but the kids are suffering. So they're growing up angry. We got another group that's growing up that ain't afraid to bust your head. You see what I'm saying? So if we don't stop it now, we're going to have some savages we can't control. And the kids need somebody now. They're asking for us right now. But we don't utilize the people. We want to have programs, and then we come in for like a little month or two, and the program gone. But you got people like Grace, and you have people that come in on a daily, support these people, back your community leaders, give us the Narcans, give us the stuff that we need to help, because the Our Heart team take too long. When we found the lady passed out on the Mexican people port, you see what I'm saying? She wanted to get off crack. She's only 22 years old. But by the time they never came. So that little girl, that lady is still walking around with her wig turned backwards. You see what I'm saying? That's another person that's lost. When they want help, we need to move now. Give us the information so we can know who I need to call to move now. I shouldn't have to go to social media and say, hey, I got somebody that needs to get, who going to help me? I had people rushing off social media to come over here to help me, but the girl was already gone. So this is the stuff, we in a community that everybody's here. Find us, get us together, and find a way that we can really help. Thank you.
So I'm going to step in just really quickly, because I want to make sure we understand exactly how this is going to work. What you just heard is, I don't know if we could put it in a nutshell better. That is the reality. That is what I hear. And Tanya, you and I have been talking for years. That's what I hear. And that's what drives me to want to bring us all in this room. I also want to be very clear. Dr. Thomas is just a facilitator. I don't want anybody in this room looking at this man to do nothing. It is on us here locally. He and his team are facilitating this conversation over the next 3 days. This work is on us. And I've told Ryan, I know I have very little capacity to do anything else, but this right here, I got time. So I'm going to be engaged. Dr. Lee is going to be engaged on this as the leaders of the city and the county. We're going to have the schools obviously involved. I've already said I want a whole youth summit as well. So we're going to get there as well. But I don't want people to have the idea of, well, what y'all going to do about this? There is no such thing as y'all. Only us in this room. Y'all is too many letters. It's just two. U and S. This is our work because these are our issues. There are examples of other cities, but that's not our business. Those are just examples. Our work is in Durham, and our solutions will be in Durham. You are in this room because you are part of the solution. I have no more patience to try and rely on anybody else that does not have a Durham zip code. Okay? So as we're asking our questions and making our comments, Tanya, you just talked about resources. Yeah, I remember you sharing those with me. Those are solutions. So we need to keep the streets clean better, then that's what we're going to talk about at the city. The water needs to come out clean, we're going to talk about that. We need resources, Narcan, whatever, that's what we're going to talk about at the county. But part of this is making sure we better understand what resources we do have, whether it's city or county or schools, and make sure we activate those. What resources we don't have, we have to activate those. We have to get those. And that's where we're going to draw. So I was a little hesitant about allowing questions at this time because we haven't gotten to the solution part yet. But I'm glad we're getting the questions because we're getting some testimony of what's going to inform this working group. But even the working group is not the one-all, be-all solution finders. It is for you all as community members, and there are a lot of folks texting me that are watching online right now. You can email my office, Dr. Lee's office, the city, the county, people around this working group, and we need to figure out a communications plan to make sure we can receive information. I don't know how we do that, but smart folks, that's what y'all could do. So that we can continue to have the ideas coming in. We've already done 6 months of listening sessions. We're still not done listening, but we do have to start somewhere. So I just wanted to level set us and understand that I don't want us to get into the expectation that these folks from Maryland or Penn or somewhere is coming to do this for us. They're just facilitating the conversation. It is on us. So let's look internally, and as we're talking and asking questions and making comments, put the mirror in front because it applies to you first. That's what I'm doing. That's what I want to invite everyone in this room to do. Thank you.
Thank you, Mayor. All right, we have time for one more question, and then we're going to move on to the next session.
Brutally honest with you. You talked about collaboration a lot of times, and here's where the collaboration falls apart. The folks who's leading it, they come to us, they collect our data, they take our data, they go get the money, but they never come back to us. And bring us in. They get the money, but they never come back to us to serve the community. That's why the collaboration falls apart.
And I just want to address this. This is something that we've started a conversation with when we had some prior programs, and that's one of the things that our working group is going to be very intentional about, because this is going to be community-led driven, and we do recognize that there is a lack of coordination, and that in turn leads to lack of collaboration and partnership. So that is at the forefront of what we're hoping to, out of our strategies and our implementation, because we know the implementation is going to be if we don't start strong implementation, whatever else after that is going to fail. So our intention is that however we're going to move forward, we have to look at how we can make our collaboration and coordination stronger, because that's the only way it's going to work if we're working together. And I think Rashana mentioned it before, is some people don't even know how to collaborate and work together and partner, but that is going to be, yeah, that's it. It's got to be built off the trust, and it has to be both ways. It can't just be one person getting everything and then the other person, I provided, but I don't get anything in return. So we have to make sure that collaboration and partnership works from the very beginning, and that's going to be from strong coordination.
All right, thank you. Thank you for everyone who stood up and asked a question or shared a comment, for those who are online and sending questions to the mayor or others. We will be sharing a full report of our listening sessions we'll be putting out on the website, and we'll be sharing it out as well that has additional information. We're now going to transition to the next topic. So we started off really focused on what we have heard directly from people who live in Durham, from stories, from qualitative data. We now want to talk about Durham-specific data. What do we know about fatal and non-fatal shooting data over the last 5 years? Because as the mayor has said, we are building this locally with local experts, with local wisdom, but also with local data. This next conversation is going to present to us what we know from shooting data over the last 5 years, again, to help us focus on the North Star that brings us here today. If we want to focus on saving lives and saving lives now, we need to understand violence in Durham, especially violence that is costing people their lives, understand as much as we can about that so that we can focus our time together. I'm going to invite up to do this. We have two guests, Lisa Burrell and Reagan Cunningham, both from the Crime and Justice Policy Lab. Just briefly about them. Lisa has her PhD from Northwestern University and specializes in urban gun violence interventions and local violence dynamics. She has conducted comprehensive violence analysis in numerous cities across the United States to build data-informed public safety strategies. Reagan Cunningham is director of the Crime and Justice Policy Lab West, where she works with service providers, law enforcement agencies, impacted community members, and elected officials to reduce shootings and homicides involving street gangs and groups. Reagan formerly directed the Oakland ceasefire strategy from 2012 to 2018, leading to historic reductions in homicides and shootings there. Please welcome Lisa and Reagan.
Thank you, Ryan, and thank you all actually just for being here today and taking the steps to help improve safety in your communities. So the gun violence problem analysis, let's think about it this way, is that in order to be able to reduce gun violence, we need to understand who and what is driving gun violence in your community. So this isn't national data, this is Durham specific data. So the information that my colleague is going to present is specific to Durham. This document, and it's lengthy, so we're going to walk through it, and we'll be here to answer questions. It is quite lengthy. Helps us to understand that. What this should give you is an idea of the demographic of who is at very highest risk of gun violence in your city. Because once you understand who's at very highest risk of gun violence and what is driving gun violence in your city, then you all can make informed decisions about what type of strategies are going to be effective with this population and with the challenge that you have. So that's the purpose of this analysis, and like I said, it is quite lengthy, but I do think it will give you some good information so you all can make some informed decisions about what the next steps are and what's going to be right for Durham. So with that, I'll let Dr. Burrell take it from here.
Morning, everyone. All right, I figured it out. So as Reagan said, today we're going to go through the results of the problem analysis that we conducted in Durham. We'll go through some basic trend data. We'll take you through the actual gun violence analysis. We'll also talk briefly about high-risk groups and gangs and networks in the city, and then we'll discuss some of the findings. I'm a little bit shorter than some of your other presenters. Is this a little bit better? All right, so to start off, a problem analysis is a well-established methodology. It's been used in dozens of cities nationally. Typically, a problem analysis is conducted to learn more about the drivers of violence in a community, both at the individual level and at the incident level. As Reagan noted, the goal of having this data is to develop a shared understanding of the nature of violence, the highest drivers of violence, so that that can inform policy decisions in your city. So in terms of how a problem analysis is conducted, what we did was we collected data on all homicides and non-fatal shootings in the city of Durham. We looked at all homicides from 2021 through 2025, so that was 197 homicides. And then 1 year of non-fatal shootings. Since there are more non-fatal shootings every year, we have a smaller sample size, and we just looked at 2025 for those incidents. So the Durham Police Department provided us with data on all of these incidents. Once we had that data, we actually sat down with investigators for every one of these cases. We talked through the circumstances of the incidents, we learned more about the individuals, and we also went through the criminal history of individuals who were involved as well. So just as a side note, this was a huge undertaking for Durham PD. They were very responsive, very open and receptive to us, so a huge thank you to them for this process as well. Okay, so we'll start just by going through overall trend data in Durham just very briefly. So this graph is showing Durham's homicide rate per 100,000 population over the past 10 years. So the rate, as you can see, started to creep up around 2019 and then went to a stronger elevation from the period of 2021 through 2023. This was a pretty typical trend that we saw nationwide, as I'm sure you're all familiar with. But over this 10-year period that we looked at, the average homicide rate was 12.7 per 100,000 population. Just for the purpose of comparison, we also have the trends here for North Carolina statewide, as well as the United States. So you can see that Durham's homicide rate is routinely about double both the statewide and national rate. This graph is displaying the homicide counts per year over the same time period. So looking at these numbers, again, you can see that 3-year increase from 2021 through 2023. There was a 24% increase from 2020 to 2021. That stayed elevated for 3 years before there was a slight reversion back down, a 23% decrease down in 2024. So this overall, the trends that we're seeing, again, quite similar to other cities nationwide. So even though the average homicide rate sits around 12.7 per 100,000 population over that 10-year period, there was that 3-year period where you saw a higher elevation from 21 to 2023. That's similar to most cities in the U.S. who saw the increase during the same period, during that post-pandemic period. And then began to revert back down a little bit in 23 and 24. Okay, so turning to the actual gun violence analysis. Once again, for the violence analysis, we examined 5 years of homicides, 2021 through 2025, and then 1 year of non-fatal shootings. So for all of those incidents, we're exploring victim and suspect demographics, criminal history of those who are involved in these incidents, as well as incident circumstances. Because we're looking at 2 different time periods, and also because we're looking at 2 different types of incidents, so again, fatal incidents versus non-fatal incidents, you'll see that they're broken out separately in all of these slides. So we'll look at the trends and the patterns for homicides, and then separately look at the trends and patterns for non-fatal shootings. So just starting off with demographics, these are homicide victims and suspects. The majority of homicide victims and suspects were male, so about 86% overall. About 80% of homicide victims and 87% of homicide suspects were Black. About 11% of victims and suspects overall were Hispanic. In this last column over here, we're displaying the demographics of Durham's population overall, and that's important to look for patterns of overrepresentation. So as you can see, when we look at sex, men are 47% of the population, but make up 86% of victims and suspects. And then if we go down to race, Black individuals make up 34% of the population, but 83% of homicide victims and suspects. This is the age of homicide victims and suspects. So overall, most victims and suspects are falling in these middle red categories, so 18 to 34. 57% of homicide victims and suspects were between the ages of 18 to 34. And then the average age was 30 years old. Here, again, we're just separately looking at the victims and suspects of non-fatal shootings. So we do have fewer non-fatal shootings in every city that are actually solved and have suspects. So I'll flag this as we go through, but as you can see, the number of suspects is substantially lower than the number of victims. So I'll just encourage you to interpret the suspect line with a little bit of caution because we're looking at those smaller numbers. So small changes can make huge swings in the percentages. So here, in terms of sex, 84% were male, 80% of victims and 87% of suspects were Black, about 16% were Hispanic, and then the same earlier comments about overrepresentation apply here. So men and Black individuals are overrepresented as victims and suspects of non-fatal shootings in comparison to their representation in the population overall. Next, again, we'll look at age for non-fatal shooting victims and suspects. For non-fatal shootings, there's a little bit more spread in age in these middle brackets. About 75% of victims and suspects were between the ages of 18 to 44. The average age was, again, 30 for victims and suspects of non-fatal shootings. So just overall, looking at these two types of incidents, homicides versus non-fatal shootings, demographic profiles are relatively similar overall. Okay, so next we'll look at the criminal histories of victims and suspects who are involved in these incidents. And I'll start with a data note, and hopefully I don't lose you or bore you on this, but it's important. So because of statewide issues related to access and to criminal histories, we had to access criminal history data publicly. Just as a point of clarification, usually we have rap sheets actually printed. So we were accessing open public data. There's just a couple of limitations that I want to mention based on that open data. First, we were looking at all prior arrests according to North Carolina Judicial Branch data. This is just by design going to be a slight undercount. So if arrests were expunged, they would not be present on this website. We also wouldn't have access to juvenile arrests. So the estimates that we're giving you are conservative. They're, again, likely to be a slight undercount. In the same way, we also accessed supervision data, incarceration data through the North Carolina Department of Adult Correction. Again, it'll be a slightly conservative estimate. We wouldn't have juvenile data according to this website. So just take these data points with a little bit of caution. Hopefully I didn't lose you, but again, just important to mention. Okay, so again, starting with homicide victims and suspects. This is presenting information about their criminal justice system contact. So about 65% of victims and 69% of suspects were known to the criminal justice system before their involvement in the homicide, meaning that they had at least one arrest before their involvement in the incident. Of those, for most people, it wasn't just a one-off arrest. They were heavily criminal justice system involved. So 49% had previous incarceration, 57% had been convicted of a felony, 68% had prior probation, and 31% had prior parole. 15% were on active probation, and only 3% were on active parole at the time of the incident. Overall, victims and suspects had an average of 12 prior arrests before their involvement in the homicide, with about 5 of those involving felony charges. And this slide is just digging into the types of offenses that these individuals can be involved in. If you look at this total line at the bottom, it's going to be slightly larger because there can be multiple offenses involved in the number of arrests that you saw on the previous page. So within those arrests, most of the offenses were what we call cafeteria-style offending. There's actually a pretty widespread across these different categories. So a range of different offenses were committed, but most commonly, these offenders were engaged in more property offenses and disorder offenses, followed by drug offenses and unarmed violent offenses. So again, turning back to the victims and suspects of non-fatal shootings, they do look quite similar overall, just with slightly lower criminal justice system involvement. Again, I'll caution you on that suspect category because the sample drops even lower since we're excluding juveniles here. So only 39 suspects are listed. Those percentages are going to look a little strange. But overall, 58% of victims and 75% of suspects had at least one prior arrest before their involvement in the shooting. Of those, 34% had prior incarceration, 49% had prior felony convictions, 65% had prior probation, and 20% had prior parole. 14% were on active probation, only 1% were on active parole. On average for shootings, the victims and suspects had 10 prior arrests before their involvement in the shooting, with about 4 of those involving felony charges. And again, just looking at the types of offenses, this looks pretty similar to homicide. Victims and suspects showed predominantly the same patterns. Most of these individuals were involved in property and disorder offenses, followed by drug and unarmed violent offenses.
So let me just, hopefully you guys can hear me, I'm pretty loud. So let's just stop here for a sec. There's more slides to go through as we get into the specifics of the incidents and gang group affiliation, all that. But I want to stop here in the sense that, so basically in summary, what we're seeing so far is, again, looking at the demographic who is at very highest risk of being involved in a shooting and or homicide in Durham, is that we're seeing that there is this significantly impacts African American male adults who are known to the criminal justice system. So as you saw in the prior slides, African American males are overrepresented in comparison to the population. These are most of the, I mean, you all probably know this. Again, I'm just trying to summarize the information that was provided. African American males are overrepresented in comparison to the population. Those are folks who are getting shot and killed in the city. Again, most of the individuals also who are getting shot and killed in the city are adult males. So this does not mean, let me be clear, that people who are under the age of 18 aren't getting killed. It doesn't mean that people over the age of 44, as we saw in the shooting category, aren't getting shot. That is happening. And what we're seeing is that the vast majority, that the average age is 30. So again, as we kind of walk through the rest of these slides and as information is presented this afternoon and tomorrow as we think about effective interventions, if the average age is 30, then we need to think about interventions that are going to be appropriate for someone who is in their mid-20s to 30 years old, who is highly known to the criminal justice system. As Lisa mentioned, a significant number have been convicted of felonies. So again, just think about this information as we kind of put it together. Older African American male, very well known to the criminal justice system and convicted of a felony. And she'll go through the rest in terms of like the circumstances and then gang and group affiliation. But so far I want to just kind of wrap that up because it is a lot of data, a lot of numbers. But I want to wrap that up of like, this is what we're looking at specifically in Durham.
Okay, so next we'll turn to the incident circumstances. In terms of location, the homicides and shootings that we looked at during this time period were pretty widely spread throughout the city. However, when we do kernel density estimation, you can see that there are clusters, concentrations in a few key areas of the city. I will come back to this map in several more slides. There's a lot to go when we talk more about active groups and gangs and criminal networks in the area. But these are the key areas of concentration within the city. So for incident circumstances, first I'm going to start by reviewing homicides. for this review, we did collect information on all types of homicide, gun and non-gun, but as you can see, the vast majority, so 90% of homicides, criminal homicides that occurred within the city were gun homicides. And apologies for the formatting. I think when we sent it back and forth, everything got messed up. Okay, so when we look at these incidents and we try to tease apart group or gang involvement in these incidents, we look at it in two different ways. The first way to look at group or gang involvement in these incidents is to look at whether the incident itself was motivated by a gang conflict. By this, we mean that a shooting or a homicide happened because Gang A is a rival with Gang B, and so they were shooting at Gang B, right? Purely just a gang-on-gang conflict. So when we are characterizing gang-related homicides in that way, 21% of these incidents were motivated by a group-on-group conflict. However, the other way to look at this is to look at group or gang involvement at the victim or suspect level. So this is just whether the victim or the suspect or both were group or gang affiliated, regardless of the motive for the incident. So maybe it's a drug-related dispute. That's at the center of this homicide, but it's still between gang members, or one person involved was a gang member. And this is really representing the risk of the people who are involved in these incidents. So when we look at whether the victim, suspect, or both were group or gang involved, across all homicides, at least 52% of these incidents involved a group or gang member. You can see that another 26% involved unknown group or gang members. That's frequently because the suspect in this incident might not be known, so we can't say for sure that the shooter was or wasn't group or gang involved. So at least 52%, potentially more, were group or gang affiliated. And then if we just look at this at the individual level, looking at victims versus suspects, we see that at least 34% of victims were group or gang affiliated, and at least 56% of homicide suspects were group or gang affiliated. In terms of circumstances, the greatest share of homicides, 24%, resulted from personal disputes between individuals who were known to each other. These were often disputes over money, personal property, women, a big one. The second greatest share was disputes that were between groups. So again, these were gang-on-gang conflicts, Group A versus Group B. That accounted for 17%. And then an additional 4% of incidents involved internal group disputes. That's where we get that total of 21%. And then third, the greatest share of circumstances for homicides was drug-related disputes, and that accounted for 11% of these incidents. After that, you see that the fourth largest share was instant disputes. I just want to explain what that category is. So these are really sudden disputes that arise between people who are typically unknown to each other. A good example of that is like a road rage incident. So just a very sudden dispute between individuals. In this table, the last column is showing the percent of these incidents that are GMI, which is group member involved. So what percent of each category involved group or gang members as victims, suspects, or both? And this is just reiterating the earlier point that even though the motives are different, right, drug-related disputes, instant disputes, robberies, still a very large share of each of these categories is involving group or gang members as victims, suspects, or both. And just, we can narrow this focus even a little bit more by looking specifically at just those dispute-related homicides. So 66% of all homicides involved disputes, personal, sudden, drug-related, and these were disputes between individuals or groups. And then within that subset of just dispute-related homicides, 66% of those involved a group or gang member as victim, suspects, or both. So again, just highlighting the risk and the potential to escalate to violence for people who are group or gang affiliated. Okay, so next we'll turn to non-fatal shootings and look at the circumstances for those incidents. But of course, I have another data note on these. So as I said earlier, shootings in cities and police departments across the country are solved at a much lower rate than homicides are. So for these incidents, we had nearly 39% of non-fatal shootings were coded as unknown circumstances. So for these incidents, that's typically due to a lack of victim cooperation. Shooting victims and witnesses are less likely to cooperate than the witnesses that we have affiliated with homicides. So we see this pattern in cities and police departments nationwide. But that also means that we're missing a lot of information on some of these incidents. So I would just interpret some of the circumstances and some of the statistics that we're presenting in this section with caution, given the fact that we have less information about these incidents. So first, we'll look at group and gang involvement, again, starting in the first way, where the motive for the incident is a gang-on-gang conflict. So for non-fatal shootings, about 9% of all of these incidents were motivated by a gang-on-gang conflict. But when we look at specifically the group or gang involvement of victims, suspects, or both, you see that it's a much larger percentage. So at least 32% of these incidents involved a group or gang member as victims, suspects, or both. And then just reiterating my point, you see a much larger share of unknowns here due to the fact that we have less information about these incidents. So likely to be a larger share, but we know for sure at least 32% involved gang members. At the individual level, for victims, at least 23% of these incidents involved group or gang members, or at least 23% of victims were group or gang affiliated. And then for suspects, at least 44% were group or gang affiliated. For circumstances, the greatest share of non-fatal shootings evolved from instant disputes, so 21% of these incidents. The second largest category was robberies at 12%, followed by disputes between gangs at 9%, and then personal disputes at 9%. So again, in the last column, a notable share of these different categories of motives still involved group members as victims, suspects, or both. Down at the bottom, you'll see that unknown percentage, so 39% of these incidents evolved due to circumstances that were unknown to investigators, and in those incidents, victims were uncooperative in 68% of those. Okay, so just recapping some of the broad themes of all of the data that I've just covered. First, again, victims and suspects were overwhelmingly young Black males. In particular, Black individuals were overrepresented among victims and suspects of homicides by a factor of about 2.5. Most had extensive prior criminal justice system involvement. They had committed an average of 15 prior criminal offenses before their involvement in the homicide. And even though only 21% of homicides were classified as gang-on-gang conflicts, gang members were involved in a much larger share of these incidents. So at least 52% of homicides, potentially up to 78% when we account for unknowns, involved gang members as victims, suspects, or both. And then finally, most homicides stemmed from personal disputes between individuals who were known to each other, and those personal disputes involved a range of different circumstances. For non-fatal shootings, these incidents largely mirrored what we saw with homicides. So victims and suspects were predominantly younger Black males. Black individuals were overrepresented by a factor of about 2.4. Most had prior criminal justice system involvement, and they were involved in an average of 12 prior criminal offenses before their involvement in the shooting. Gang involvement was, again, prevalent in a really meaningful share of these cases, but it wasn't the primary driver that was known to drive most of these shootings. Most shootings evolved from instant disputes and robberies, though group-related disputes did account for 9% of these incidents. Still, I'll just remind folks that we had a much larger share of unknowns when we looked at non-fatal shootings, so this is probably not the full story behind these incidents either. Okay, so one consistent theme that keeps coming up in these homicides and shootings is the role of groups and gangs. So regardless of motive, group and gang associated individuals were involved in a really large share of both homicides and shootings. So we did look a little bit deeper into these dynamics in Durham. We met with Durham Police Department personnel to talk more about gang dynamics in the city, talk through relationships, areas where they're most active, and we'll just briefly present some of that information here. So when we met with Durham PD personnel, we talked through several different gangs in the city. We asked them to talk about who are the gangs who are currently active in violence or have been active in violence within this time period that we looked at, this 2021 through 2025 time period. And then they also provided us with information about their relationships with each other and their locations. So this is a sociogram of identified groups. Relationships are obviously very dynamic, so this was historically some of the most consistent relationships that Durham PD shared with us. If you look at this diagram, you can see over here on the right side that Sureños, Latin Kings, MS-13 are present. However, they don't routinely conflict. They're not especially active in violence in the city. When a conflict comes up, it tends to be more transactional, more business-related. So they stay a little bit quieter. And then in the middle, you can see more of the relationships between the core gangs in Durham. Some of these relationships, you have other cliques and neighborhood groups within them. So 9 Trey Bloods does involve a few different neighborhood groups. These are some of the more recent ones. Same with 8 Trey Crips. But overall, these are the key relationships that were outlined. We also looked across all of the incidents that we reviewed, so homicides and non-fatal shootings during this time period. What was the group involvement in these incidents? For this chart, this lays out which groups were involved as victims, suspects, or both over this time period. There are 2 categories here, just Blood and Crip, where investigators didn't know the specific set of those individuals. So this chart gets a little messy, and we aggregated these categories so that you could see the representation a little bit more. Unsurprisingly, I'm sure to most folks in this room who know the city, Bloods and Crips were involved in the greatest share of violence by far when compared to other groups in that original sociogram. These are the territories. I use that term loosely. They're more just areas where these groups and gangs are active. But some of the key areas, this is the citywide map. You can see down at the bottom, we have highlighted both Cornwallis Apartments and McDougal Terrace because there are several gangs who are active within those areas, and they do turn into hotspots. This slide just zooms a little bit more. And again here. And then, as I said earlier, that I would bring back the heat map, here it is again. And you can see that these hotspots very reliably overlie the areas where groups and gangs are most active in the city. And this one zooms in a little closer on those hotspots.
And so just a couple things I want to add. Again, as we're building and understanding the demographic who's at very highest risk in Durham, now the other category we'll add is gang and group involvement. So that's another thing, again, as we look at what are the appropriate interventions, again, adding that layer of for CBOs and organizations who can work, incredible messengers who can work effectively with that population. The other thing with these heat maps is, I'm not sure if it's today or tomorrow, but we'll be talking about place-based strategies, so strategies that are specific to certain area, neighborhoods or geographic areas. This is important when we look at these heat maps in terms of where are the areas in the city that seem to be most impacted by gun violence. So thinking about place-based strategies that could be effective in these geographic areas.
Okay, so just to summarize this section, the information on groups and gangs, when we talked to Durham PD, they identified 10 different gangs that were active in violence during the time period that we were looking at. The 10 groups do include multiple different subsets and neighborhood cliques, so I'm talking at a broader level. But the estimated membership size for all of these groups was 430 to 685 individuals, which is 0.2% of Durham's population. Of the 10 groups, Blood and Crip sets were involved in the greatest share of violence, so they were involved in 33% of all homicides and shootings. And when we look at just the homicides and shootings that involved group or gang members, they were involved in 73% of those homicides and shootings. So I'll just briefly discuss the findings overall, just at a broad level. So trend-wise, Durham experienced a pretty substantial increase in serious violence during the study period of 21 to 25. Though, as we saw, it did come back to really a baseline normal in about 2024, 2025. Overall, across these incidents, serious violence was concentrated among a relatively small proportion of young adult men with serious criminal histories. So again, about 67% of homicide victims and suspects and 61% of non-fatal shooting victims and suspects had prior criminal justice system involvement. On average, these individuals had been arrested nearly 11 times for 13 different criminal offenses before their involvement in the homicide or shooting. So, of course, this does suggest that there are multiple opportunities for intervention before these incidents occur. The circumstances of these incidents do show that most violence is driven by ongoing conflicts and disputes, as well as retaliatory violence. Gang dynamics were present in a lot of these incidents as well, but most homicides seem to emerge from interpersonal disputes, other types of disputes like drug-related disputes, rather than incidents that were motivated just primarily by a gang conflict. So that also indicates that intelligence-driven focused strategies can make a difference given those circumstances as well.
And I'll just conclude by saying that first, there are a lot of numbers in here, but I think, as you all know in the room, behind every number is a person, is a family that is going to be significantly impacted or has been significantly impacted for generations to come. So I don't want that to be lost on these numbers. At the same time, I'm hoping that that can fuel our conversations for later this afternoon and for tomorrow and the next day, of using that energy and using that focus at what we're talking about here, and I think what we're hoping to accomplish in partnership. It's about reducing gun violence in the near term. So I'm intentionally using the word intervention. So there is prevention, which is the long game. We need to have that. Folks need to continue to do that work. That also has to be tightened up. So that's prevention. What we're talking about here is the intervention, meaning how do we get reductions in the near term with folks who are at the very highest risk of gun violence right now. And so that's why having an idea or an understanding of that demographic of who is at very highest risk right now is going to be important as you all think about strategies that might be appropriate and interventions that might be appropriate in the city of Durham. And then I'd say lastly, we think about community transformation. So there will be a discussion, as I mentioned, on place-based initiatives. I think it came up a little bit earlier this morning of how do we begin to transform communities that have been impacted by gun violence, by poverty for decades. And so that's where, again, there's a role for community transformation as well. But I think it's important to make distinctions in those categories, and the conversation, I believe, for today is going to be more about that intervention. How do we get reductions in the near term? And one of the surefire ways of being able to do that is intervening with individuals who are at the highest risk of gun violence right now. So I know there's a lot of slides, and I'm sure at some point you'll have an opportunity to go through it because it is a lot to digest, but I'm hoping it's helpful and informative so that this information can be used as we have these discussions later today and the rest of the week. So thank you for your time and attention given all of this information. Really appreciate it.
All right, we have some time for questions. So again, if you have a question or comment, please raise your hand and someone will bring a mic to you.
Is it on? Can you hear me? Thanks again for sharing that data. Something struck me as interesting. Durham has to be the only city where its non-fatal shootings are smaller than homicide. And so that struck me as odd. Normally, the ratio is about 3 to 1. And so am I understanding clearly that we had more homicides than non-fatal shootings in Durham?
No. So we actually looked at different time periods for those different incidents. The reason there were 197 homicides is because that was from 2021 through 2025. For non-fatal shootings, we had 102 non-fatal shootings. That was just for 2025, okay. 1 year.
And the reason we only looked at 1 year was because?
Resources.
Important thing. And the reason I ask is that distinguishing between fatal and non-fatal is really not that important in terms of demographics because the issue of poor shooting, better trauma kind of interventions. And so I do want to make sure folks understand that sometimes fatal versus non-fatal is not as important because it's not because of the incident. But for example, we didn't talk about types of weapons today. And so it would be good to understand, is there something unique in Durham in terms of types of weapons that we're having to deal with from an intervention standpoint? And then the last thing I will say is that also removing things like domestic violence, I think we started off the conversation, our interventions won't look at domestic violence. I think it was like 15 in one of those numbers. So as we're thinking about how we disaggregate numbers with respect to where you want us to focus our interventions, I think that will be important. And then the last thing I wanted to know is that for the non-fatal shootings, was there anything unique with respect to this issue around growing numbers of young women involved in violence? I know the numbers are still low, but from a trends perspective, did you see anything along those lines? Thank you.
I'm probably going to forget half of your questions, and I apologize. So we do look at homicides and non-fatal shootings because we just don't believe you can get a full picture of gun violence without also considering gunshot wound victims who were not killed, right? So we try to look at both of those different incidents, especially because there is the possibility that non-fatal shootings differ substantially from homicides. It's a small subset of cities, but in some cities we do find, for instance, more mental illness or drug involvement in homicides. So then those incidents will look substantially different from non-fatal shootings. Not the case here. The majority of homicides 90% were gun homicides, and circumstances and demographics pretty well mirrored each other. So that wasn't a pattern that we saw in Durham. Still, we think it's important to look at both and tease that apart in different cities. I have already forgotten the other questions.
Females, the role, I'm sorry. Yeah. So the only other important question, understanding the role of females involved in issues of violence in Durham, are there any trends that were surprising to you?
Not surprising. You do see a slightly larger number of females typically involved in non-fatal shootings, and that is usually because non-fatal shootings are more likely to involve bystanders or more victims, multiple victims, in which case we see more women pulled into that dynamic, even if they're not the actual target of the shooting. So we do see that number rise a little bit, not significantly though.
Good morning, Chelsea Cook. I'm on the Durham City Council. I just have I have 3 questions. The first one is very easy, which is where all will these statistics be available and how widely are we sharing them?
And made publicly available, all the slides. That's, I think, an answer to number 1.
Okay, thank you. And so I actually want to follow up on this gentleman in front of me asking about distilling out the community violence, this idea that we talked about at the beginning versus the domestic violence and other things. So we saw from our first quarter crime report that 30% of our aggregated assaults this year in Durham were domestic violence in nature. And then there were several of our homicides were as well. So I would like maybe a follow-up on how we are distilling that information out, or whether or not that's maybe important for the goal of this short-term intervention as opposed to the prevention.
I think the challenge here, it's important to acknowledge all of these different forms of violence. When I'm speaking about these issues nationally, I often say we don't have one gun violence problem. We actually have 4 separate but related gun violence problems. We have a gun suicide problem, we have a community violence problem, we have a family or domestic gun violence problem, and then we have a mass shooting problem. The challenge is that those dynamics, the dynamics of those phenomena, although they all involve guns, are actually quite different, and the policy solutions are quite different. And so the solutions and the expertise needed to craft a really good domestic violence strategy are going to be different, although related, to the ones that are focused on the community violence. And one of the things we often say in this work is we're not in the homicide elimination business. We're in the homicide reduction business. And our goal right here is to stop the bleeding. And what we're trying to do is address the single largest driver of homicides, which is the community violence, this dispute-driven, sometimes often involving group-involved people, but not necessarily about group dynamics, that conflict and dispute-related violence, to drive down those numbers. So there's a very good reason for keeping these initiatives separate, but clearly those domestic violence numbers are serious, and we need to have separate effort to address them.
Yeah, it's just something I'm thinking about as we're talking about having different strategies, and I understand the reasoning for that, but also as we're getting data that doesn't distill out those types, that just want to make sure that we're kind of looking at accurate data as we're creating the strategies. And then my final question is, was there a connection between, or did we look at a connection between victims and then later perpetrators? My understanding from some other research that's been done across the country and other intervention strategies is that folks who are victims in gun violence often then later become perpetrators. I've heard statistics anywhere between like 50 and 80% within a year. So I was just wondering if we looked at that data.
Is this projecting? Yeah. Okay. No, that's a good question. We only looked at crossover within our data set. So we would only know that if they were represented twice within our data set as both a victim and suspect, or a repeat suspect, repeat victim, or what have you. It affected less than 5 of our individuals in this particular data set. That being said, we weren't able to look at broader measures of victimization. So for instance, we didn't know if someone was previously the victim of an ag assault that didn't result in a gunshot wound, right? So there are other serious measures of victimization that can possibly be gleaned from police data sources if they have access to victimization information. So that could be looked at further, but for this particular study, we could only tell within our data set.
But just to your point, while it's not showing up in this specific data, there is a ton of research about that, and we know that from decades of practice. Overwhelmingly, perpetrators have been victims of violence first. And one of the things that's interesting, if you look at these two groups, supposedly separate groups of individuals, suspects and victims, demographically, they're almost identical. And so that's something also to keep in mind, is that today's victim is tomorrow's perpetrator and vice versa. And that's something that we're very aware of, even if it doesn't show up specifically in this problem analysis.
I think just to echo Thomas's point, that traditionally you do see a lot of overlap between the victims and suspects, but I would just encourage you all, as you think about strategies, again, that are going to be appropriate for Durham, and I've talked to some of the city officials about this, of figuring out a way to be able to capture the information from the shootings and homicides on a consistent basis. Because what we've seen in other cities that we work in, again, to Lisa's point, that there could have been a fight at the courthouse and then that leads to a shooting, right? There could have been somebody got jumped someplace, or somebody's chain got snatched, and then that leads to a shooting. So there's been this other victimization, but in this problem analysis, we're not necessarily capturing it, but that's why I think it's really important to be able to stay on top of shootings as they're occurring in a pretty real-time basis, so that you can see these themes and also see who is at very highest risk, and also get ahead of potential shootings when significant incidents jump off, whether it be in the city of Durham or also in surrounding communities. So.
Good afternoon again. My question is, we're not using juvenile data, but we're using gang and group data conflicts. Most gang members, when I say most, I include myself, because I was a gang member when I was younger. I decided to do it when I was 12 years old and get my first gun right after my birthday. So why aren't we using young people's numbers included in this number? Because they didn't decide to become gang members at 18 years old. So why aren't we using their aggregated data before that? Because we're talking about someone with 15, 16 incidents as an adult. Why aren't we using the ones they had as a juvenile and we could have intervened at that point? Why do we wait to bring them into the intervention when they're adults now with 15 different charges, when they had 7 or 8 or 9 when they were juveniles? Why do we need to wait that long, and why do we wait that long? And I understand the HIPAA data and HIPAA laws, but if we do not use name and data and certain people only see certain things, why isn't that data used? Because if we wait to reach them into adulthood, then what is the point of getting to them when they already had a prior 10 incidents beforehand?
Hey, I'm Satana DeBerry. I'm Durham County District Attorney. What I said was a simple answer to that question is that juvenile records are sealed. They are confidential. They don't have access to them, and we can't provide access to them. We don't even keep them in a public place in which you can get them. So that would require a change of the law. Now, does that mean we don't know who they are? No. Does that mean that law enforcement doesn't know who they are? No. And I'm sure in these discussions that they had with the investigators, they have at least they have at least incidental knowledge of who they have known as long as they were, who they have known and for how long they have known them. Does that answer your question? You're not going to ever see the juvenile stuff reflected up here. But that doesn't mean that we don't know who they are. Well, I mean, that's what we're here for. That, as the mayor said before, that's what we're here for. We're here to identify those folks publicly and to drill down on, you know who they are. People tell me all the time, well, the streets say this, right? One of the things we need to talk about, from my perspective, is that information that's gathered for the purposes of intervention and for information needs to be different than what we gather for prosecution. And we're very focused on gathering what we need for prosecution, but that means Ms. Tanya doesn't get talked to for information about how do we avoid things beforehand. And so what we're just trying to do is move backwards in this process, because once they get to me, it's too late. Once all this data is available, they're dead people on the ground. They're people whose lives have been impacted forever. So.
And doing the work that they're supposed to do in the community, then they need to be held accountable, and things need to change with those who are sitting there knowing who these people are. It's time to hold some folks accountable. And that's what we're going to do.
Yes. I was just talking about the percentage of the high risk. It was like 80-some% was black, and it was, you were saying that their ages were between 20 and 30. So the high risk basically is the black male, is what we're talking about here. It's no group, it's no this. We're talking about the black male. Because I didn't see any other ethnicities up there basically with a high percentage other than the black male. So the target here is the black male from 20 to 30 years old, is what y'all are targeting. Basically, right? So if they're gangbangers and stuff, and you know all the hot spots and the high-risk areas, why aren't y'all keying in on these areas and trying to get them some help and instead of trying to take them out? Give them an opportunity, something, jobs or trades, or try to get them to veer away from the gang banging, the shooting, and the drug selling, and try to get them something, because we're building new buildings downtown every day, but we're not building anything in the community. But we got building every week, new building, new house, new building, new neighborhood, new this. Exactly, but we got resources. They got an $85 million with Parks and Rec, but these kids don't even got nice parks to play in. They want to do something with the police station downtown. Turn it into a state-of-the-art rec center. It's right there by the bus station. You want to know what to do with it? But I'm going to get out of here while I can.
I really want to appreciate your comment because, again, yes, African-American males, older African-American males, I say older because they're not 12, but adult African-American males are most disproportionately impacted in Durham. At the same time, and this is why I go back to using the problem analysis as your foundation to understand the demographic who's at highest risk. It is not every black male in the city of Durham. I'm saying this, because again, just work. I know, and I know you're not saying that. I'm just want to put it out there on the record. It is not every black male in the city of Durham, but this is where we go back to how do we focus the resources that you all do have. So it's not focusing on every black male, and I kind of take this personally because I live in a neighborhood in Oakland, California, where it's like, oh, that zip code, you know, it's every black person. It's not every black person. It is a small percentage, as she indicated in the analysis. But it's understanding that demographic. It is, again, the older African-American male with significant criminal history involvement. So this is not licensed to be able to stop or unnecessarily engage with an African-American male who's 23 years old who lives in the city of Durham. That's not what we're talking about. We're talking about folks who are known to the criminal justice system, convicted of felonies, at least 15 prior contacts. That we want to narrow it down. So I'm not disagreeing with you. I just want to put, I don't know because I don't know you. Okay. Yeah. Okay. Oh no, absolutely. Yeah, absolutely. Right. No, and that's where, so the thing with the problem analysis is understanding who's at very highest risk so that you all as a community can decide what are the appropriate interventions. There was something, and I think it was Rashana's report in the listening sessions where community members were saying, we need something to the effect of intervening or reaching out to folks who are at the highest risk. I want to lift up that theme because that's what we're talking about. First, we need to understand who that is in the city of Durham, but then the discussions that you all will have, and as the mayor said, the work that you all are going to do is going back to your point. How do we intervene now that we know what that demographic looks like in Durham, what are appropriate interventions so that we can intervene with those individuals so that they can make positive decisions, so they can change the trajectory of their lives? That's the discussion for today. But we got to start with who is that so we're not having these big, broad conversations. Right.
And that's specifically why we have community voices at this table. If you look around, some may not be here right now, but they will be here through today, through Friday. We have, at this table, we have some community we have community voices that are represented because of just what you're saying. Those are the ones we need to rely on. A lot of them do have the juice, so they know who has the juice. And so we chose those individuals that are here representing different their community residents, because they are the ones that have been with us through these last 6 to 9 months that have been working. We know that they have some juice in their community, even down to Miss Kelly. I don't think I've ever met Miss Kelly, but I know that Miss Kelly is going to be somebody that I'm going to work with. I've met you one time before, and I know you're going to be, you're going to be somebody we're going to reach out to. So again, we couldn't have everybody at the table, like I said earlier, but because we know, you know who has the juice, Miss Kelly knows who has the juice, Miss Graves at the table knows who has the juice, we're going to rely on you all to help us identify those individuals. And again, because it doesn't mean today is just the beginning. Today just the beginning. Right, not yet, yet. I have your card, I do have your card. And the word is yet. So there's still work to be done. Still work to be done.
Sorry, I got one more. To piggyback a bit on the data that Councilmember Cook was talking about and keeping things in a Durham-specific context, I'm curious about if and if not, why data on housing insecurity hasn't been considered as an aspect of community violence and something that we are looking for in our solution building. When we look at that heat map, one thing that I notice is, especially along the Alston corridor, where we have a significant community of unhoused individuals, that it doesn't seem like that data is being looked at specifically. And another instance that comes to mind is like when you read an article like, another person killed on the American Tobacco Trail, and then you actually go from the macro and zoom in on that, and it's really one community right there at that Fayetteville street intersection by the Food Lion. And so I just wonder if housing insecurity is playing a part in this data collection.
So again, I think this goes back to the problem analysis is really just your kind of foundational document to help you understand what is driving gun violence now in the city. One of the things, though, that I have found, though, once cities decide on whatever strategies they're going to employ and you actually start working with folks who are at highest risk to help them make positive changes in their lives, in a lot of cities, housing insecurity does come up. So I would suspect that it's going to come up a little bit later as the city and county make a decision on the strategy, that once folks start working with very highest risk individuals and their clients and helping them develop life plans, et cetera, that I suspect that it's going to come up, and I would just encourage the city and the county to collect that data from folks that we're intervening with, because I'm pretty sure it's going to come up. So I don't think we're not ignoring it. I just think it's going to show up a little bit later as we work with individuals.
All right, I appreciate everyone for participating in that conversation, for the great questions. We are going to move on to the last session this morning. So we have taken time so far today to center the voices of Durham residents who engaged in listening sessions. We've looked at the data to understand what are some of the major drivers and where we should focus attention most when we talk about community violence. We're now going to bring up Thomas Abt for the last session, which are really focused on the principles that we can center in this work to give us the best chance of being successful. Principles that could be applied across a variety of different strategies, but principles that are evidence-informed, that when we think about what we have heard from Durham residents, when we look at the data, these are principles that align with that can give us the best chance of being successful. Thomas?
Thanks, Ryan. So the idea here is to give folks in the working group and in the room at large a sense of the principles that have been most effective in reducing violence across the country. It's ultimately going to be up to the folks in this room how best to apply those principles and to make concrete decisions around them. But it's good to know the sort of general direction that has been most successful. And also, it's just good to make sure that we're really on the same page as we start this effort. So in terms of that, I just think we need to, again, just make sure that we understand the definitions, because if we're not talking about the same thing, we can get off track very quickly. When we're talking about community gun violence, we're talking about gun violence that is happening in community settings. It's sometimes known as street violence. It's connected but not the same as youth violence. It's also a form of gun violence. It's the everyday violence that is causing the most homicides and shootings on the streets of Durham. And it is primarily committed by, adult men without a lot of opportunities and without much hope. And as you have heard, that is often a retaliatory cycle of violence where victim and perpetrator can be blended. Why do we focus on this? Because it's the #1 driver of homicides. This is the way we can save the most lives. There's no way to quantify the suffering of a mother who's lost a child. There's no way to measure a young life cut short. But when you do an economic analysis of all of the various costs associated with gun violence, the costs are massive. A conservative estimate is that every homicide costs anywhere between $10 to $19 million in total social cost. And if you look at that, if you multiply that by the 33 homicides that Durham had last year, and just using the $10 million figure, that's at least $330 million in total social cost that the city has spent on these tragic events. And it's just incredibly important to understand that high rates of community gun violence, especially homicide, are going to make everything that Durham wants to do harder. It's going to make, especially in these impacted communities, high rates of community gun violence are going to make it harder to reach your health outcomes, your commercial and economic outcomes, your housing and education outcomes. Violence is going to make all of these things harder because without a certain measure of safety and security, it is very difficult to let people thrive. So that is the problem. How do we define, we need to define both the problem and the solution. And what we need is a concrete definition. It needs to be SMART, specific, measurable, actionable, relevant, and time-bound. When I often sort of start with a sample definition of the problem. This is a definition from my book, Bleeding Out. You don't have to use this specific definition. You may define the problem separately, but it's one that that some cities have used. Unacceptably high rates of lethal and potentially lethal violence committed in public spaces, as measured by the number of homicides and shootings that result in injury. Why are we focused on violence? I've just described that. Why in public? Because we're talking about community violence, not these other forms of violence. Why lethal and potentially lethal violence? We're trying to distinguish and concretize this. We're not talking about structural violence. We're not talking about sort of violent imagery or anything like that. We're talking about serious physical violence. And why homicides and shootings with injury? Because you want to quantify this in something that is absolutely measurable. Here, when I say shootings with injury, that is a term that is used in a number of jurisdictions because it distinguishes between a bullet that actually went into a body and just a random discharge, which is very hard to measure and very noisy. But the idea is you want to hold yourself accountable by having very concrete measurements. Once you have general agreement on the problem, you can turn to the solution. And at this early stage, the details are not necessary, but what you need to agree on is a path that is evidence and community informed. What do I mean by this? Evidence informed means drawing on the best evidence and data that is currently available. It also means that key decisions should be determined not by politics, but instead by what empirical information shows will save the most lives. So what am I talking about here? What am I saying when I use the word evidence? And what's the difference between being evidence informed, which I'm talking about here, and being evidence-based, which you hear a lot in the broader conversation? Well, being evidence, there's lots of different definitions of evidence. You have the dictionary definition here, you have the legal definition with law.com, but what we're looking for here is something like the third definition: information generated through systematic data collection, research, or program evaluation that is using accepted scientific methods that are documented and replicable. You want something reliable. And that's, we're talking about making decisions that are matters of life and death, so we want some information that is reliable. The benefits of using evidence in this way: accountability. Evidence provides a way to measure success and failure. There's objectivity. It minimizes bias and provides a neutral reference point. Accuracy. It's often more effective than other methods at explaining past events and predicting future outcomes. And certainty. Because it's transparent, you know how the information was gathered, and it involves transparent rules and repeated procedures. That said, I want to distinguish between evidence-informed and evidence-based. When we say evidence-based, we often assume that the evidence is strong on every question, which it certainly is not. And we don't want to create a false sense of certainty that there's a scientific answer to every single question in this. The second thing is that when you're focused on what the evidence says today, you're not thinking about what the evidence might say tomorrow. You're not thinking about innovation and creativity, and there needs to be room for that. And then the last thing is, evidence ain't the only thing that matters. There's morality, there's all of these other things. And so we think that the better way to approach this is to say we want solutions that are informed by the evidence, not based on the evidence. And that gets the benefits of an evidence-based approach without its limitations. And it's a more nuanced understanding of the role in evidence policymaking. So what I'm going to ask the working group to do is to be informed by the evidence, not based by the evidence. Now, what do I mean by being community informed? In this context, community informed means that the effort will give voice to those most impacted by community violence by listening and inviting participation throughout the policy making and implementation process. Now, we're already off to a strong start here, as you heard from the earlier presentations. There's been a lot of care taken from the beginning to involve community in this process. But what does community mean here, and what's the difference between being community informed, which I would recommend that we do here, and being community based? Community in this context means those who are most impacted by community gun violence, meaning residents coming from those areas, and it includes both victims and perpetrators. But who represents that community? Is there one community or many, and does the community speak with one voice? I think it's important to understand that not everybody feels the same way. Like any other community, these communities are complex, and they have differing viewpoints. And so not just one person can speak for the community. The benefits of involving the community in policy making are numerous. First of all, legitimacy. If credible community leaders and members participate, the effort's going to be more likely to be seen as fair and legitimate. If it's seen as fair and legitimate, the effort's more likely to be sustained over time. And this is my favorite and I think the most important. If community members participate, policymakers will gain more accurate information, leading to more effective strategies. My point here is that involving community members is not some politically correct kumbaya thing that you do just to check a box so that it sounds like you're doing the good thing. It's actually important that you get things right. The community will help you get things right, and your strategies will be better and sharper if you listen to them and they're involved in the participation. So I just want to sort of push back on the notion that like we're doing somebody some favor by involving them. No, community needs to be here because they're going to make the strategy better. Now, when you use the term community-based, you assume sometimes that the community can be easily defined. And I think we all know that that's actually a lot more complicated than we think. It assumes that the community has all the necessary expertise and information. And I actually think that's profoundly unfair. You know, we often sort of say, it's a buzzword to say, well, you know, those who are closest to the solution or closest to the problem are closest to the solution. That's true to a certain extent, but it's also neglecting that there are lots and lots of other insights and resources and other things, and other people who are responsible for the problem who have an obligation to participate. And so I think it's important to understand that, yes, we need the community at the table, but there is a role for academics, other experts, law enforcement, and other people to blend these expertise. And it assumes, candidly, that the community wishes are the only consideration in policymaking. And that's also not the case. And I think we're not often candid, and that lack of candor can lead to disappointments and lack of trust. And so I think that that's important to understand as well. So I think that if we talk about being community informed, again, we get the benefits of community involvement without these disadvantages, and we have a more nuanced approach. The idea here is that nobody gets a veto. A good process here is not going to be one where you get a bunch of academics coming from out of town who lecture you and tell you what to do. That's not a good process. It's also not a good process to just say, we're just going to solve this all by ourselves and not listen to anyone else and not get the benefit of additional information. There's no one group here who has a monopoly on the truth. The best thing to do is to combine all of these things, and that's the more nuanced approach that we're trying to recommend here. Now I want to talk about some key principles in terms of the work moving forward, meaning whatever strategies you decide, they should be consistent with these principles. Number one is focus. Given the concentrated nature of community violence, as you heard from the problem analysis, as well as the relative scarcity of resources, we need to have a focused response. And that means targeting what matters most. So what does that mean and why is it important? You saw it in the problem analysis, but there is decades of social science research that show that in every city, Durham included, the majority of violence is concentrated and perpetrated by a small percentage of the overall population. And because of that, what we've seen across hundreds of evaluations, hundreds of strategies, is that generally speaking, the more targeted, the more focused interventions are the more successful. It's true in policing, but it's also true in gang prevention, reentry, and other things. It's not just true in criminal justice. It's also true in public health, where tertiary prevention programs tend to outperform secondary or primary. The general idea is that if you want to be successful in reducing violence, you actually have to focus directly on the violence. Now, some folks talk about displacement. Well, what if we focus on this one, on this one housing project? Isn't the violence just going to move down the street? Or if we focus on this one group, isn't another group just going to pop up? Well, fortunately, we know from decades of research that that's actually not the case. There's something sticky about violence. It takes a lifetime of trauma to prepare someone to pull the trigger. And so if you can convince that person to have an honorable out, or if you have to separate them from a community, there's not someone just ready to jump right up. And the same thing is true in terms of places. It takes decades of disinvestment to create a hot spot. And so they don't just jump around. What you've seen is a durable concentration here in the city. So there's benefits to focusing on these concentrations, and this is something that Reagan was talking about several times. Next principle is balance. We had a questioner from the audience talking about this. Balancing prevention and punishment works far better than either approach in isolation. We need a range of incentives that promote positive associations and activities while deterring violence. You need both carrot and stick. So what does this mean, and why is it important? Again, if you look across hundreds of studies of what's worked and what hasn't all across the country, you're going to find some very successful tough-on-crime strategies, and you're going to find some very successful soft-on-crime strategies. And you're going to find some very ineffective tough-on-crime strategies and some very ineffective soft-on-crime strategies. And ultimately, what the science is telling us is basic human nature. We don't raise our kids with all punishments or all rewards. We use both to maximize behavior change and educate them. These high-risk individuals are no different. So we're going to need a combination of carrot and stick in order to maximize behavior change. We need to engage these high-risk individuals with empathy and accountability. And so we're going to need prevention and intervention to divert future offenders and enforcement to deter or incapacitate them. And I've been doing this a long time all across the country and even in some cities around the world. I have never seen a city that simply arrested its way out of gun violence. But I haven't seen a city just program its way out of it either. So just keep that in mind. Now, the first two fundamentals that I talked about, focus and balance, are intended to preserve public safety. The third is intended to build legitimacy by treating communities and individuals justly. Those first two are about what to do, and this next one is about how to do it. And so what do I mean, and why is it important? We know that violence is closely associated with legitimacy. And unfortunately, that perceptions of unfairness and illegitimacy can cause violence. We don't have to look very far back in our nation's past to see that. A highly publicized incident of police violence followed by sharp increases in violence in those cities and across the country. And there's two large bodies of evidence that talk about this: procedural justice and legal cynicism. We don't need to get into the weeds right now, but the basic idea is that when folks don't believe in the system, they don't use the system. And they don't use the system for what might be its most fundamental, most historical purpose, which is the nonviolent resolution of disputes. So if you're in a community where folks don't trust the police and you don't trust the police and someone beats up your cousin, you're not going to call 911. You're going to call your boys. And then that beating can lead to a shooting, can lead to a killing, and the cycle of violence and retaliation has started. And so it's really important to understand that whatever we do in this space has to increase legitimacy and increase fairness. It can't reduce that trust or fairness. It also, just more broadly, in terms of the public safety conversation we're having in Durham and around the country, we have to reject this false choice that it's all about social justice or it's all about crime and violence reduction. We can and need to have both at the same time. And we can and should be focusing on both at the same time. Procedural fairness, and this is something that we'll talk about during our working sessions, has helped police officials rebuild trust. It's also worked for courts. And we're going to talk about what it means to be procedurally fair, about respectful treatment, unbiased and transparent decision-making, and voice and opportunity to be heard. And what we want here is we don't want it just to be part of street encounters with community members. We want to build it into the process that we're creating today. The last thing I want to talk about is if violence is concentrated among a small number of people, places, and behaviors in Durham, we need to focus on those people, places, and behaviors. And there's a difference between the way you do it, although it's similar, in terms of people-based strategies and behavior-based strategies. If you look at the most effective people-based strategies that are focused first and foremost on individuals and groups, they have these 5 components. They don't necessarily talk about them all the same way. They're not all, and they don't organize it necessarily. But all of those strategies are identifying and engaging the highest risk individuals. Once they've engaged them and established some rapport, they're stabilizing them by meeting immediate needs often associated with safety and security. Once they've got some stabilization, they're addressing their unhealthy thinking, unsafe behavior, and unaddressed trauma. One of the things you did not hear me just say is wraparound services. One of the things that we have focused too much on is for these highest risk individuals is simply giving things and not thinking about behavior change. When we provide employment, when we provide education, all of these things, the expectation is this will change behavior. And so often those things need to be complemented with behavioral change mechanisms like cognitive behavioral interventions. So when you look at the evidence and you look at jobs programs with nothing else to see whether they impact violence, no effect. When you look at education programs to see whether just education, straight education programs, to see whether they have an impact on violence, no effect. But when you look at a subsidized employment program focused on the highest risk individuals that is laced with cognitive behavioral interventions to support them at each step of the way, those show effects. So what I want to so the point here is that the most successful strategies are focusing first and foremost on behavior change and offering other opportunities in order to maximize that. And then lastly, I don't want to be Pollyannish about this. Supports and services are not going to work for everybody, and for those folks who insist on hurting the community and continuing to engage in violence, there have to be swift and certain consequences. And one of the things that, in terms of legitimacy, is the more effective your services are, if community members know that that person was outreached to 3, 5, 7 times, offered real valuable services to change their lives, and they turned them down and they still hurt the community is going to be much more willing to accept aggressive enforcement for those individuals and groups. For place-based strategies, it's similar. Of course, you need to increase the legitimate police presence in violent hotspots, but it can't just be policing. It has to be placemaking. It has to be thinking about the physical and social environment so that police don't have to keep coming back to these locations again and again. And you need to supplement policing and placemaking with community building. in each of these places, you need micro-communities of residents, business owners, faith leaders, and yes, law enforcement, who are thinking about that area and defending that area and improving that area. And then lastly, for behavior-based strategies, you know, often when we think about the sort of big three, you know, and this is the way I'm a former prosecutor, we used to think about this back in the day, is, you know, it's all about gangs, guns, and drugs. You know, you hear that a lot. But when you look at the broadest efforts to address guns, to address gangs and drugs, and see whether they actually work to reduce violence, they're not particularly effective. Why is that? Because it's overbroad, it's too general, it's not focused on highest risk. So what I recommend you do is stop thinking about gangs, guns, and drugs as a noun and start thinking of it as a verb. So think of this instead of, don't think about what are we going to do in Durham about all guns. Think about what are we going to do about illegal gun carrying among the highest risk people in the highest risk places. Not what are we going to do about all these drugs. Think about violent drug conflicts among the highest risk people in the highest risk places. And not, you know, what are we going to do about all the gangs? Think about the highest risk gangs and the highest risk gang members and their conflicts. And what you'll see is that this persistent, extremely complicated socioeconomic phenomenon that we call violence can actually start getting broken down. You don't need to be everywhere, you don't need to do everything, but you need to work with great intensity with a few people in a few places and focus on a few key behaviors. So how do you organize all this? You know, there's not just one strategy to reduce violence. We're going to introduce the working group to 5 to 7 strategies over the next 2 or 3 days. How do you make sense of all this? How do you organize it? Well, it can be helpful to have a framework, and this is a framework that the VRC came up with. It's pretty simple. It combines the public health framework with a criminal justice framework. And as you can see, you've got people, places, behaviors on one side and prevention, intervention, and enforcement on the other side to form a grid. And then if you look at my book, Bleeding Out, and all the strategies that it discusses, that's where they all fall. So you've got things like shooting investigations and problem-oriented policing for people-based enforcement. For prevention, behavior-based prevention, you've got cognitive behavioral interventions and family programming. The idea is not that every city is doing all of these things, but that you have a sense of how your programs are interacting and aligning. And for the purposes of this summit, what we'll be focusing on is the intervention and enforcement. Again, not because the prevention isn't important, but prevention by definition is going to take years and years to show results. And what we're trying to do here is have immediate results. All right. That's the end of that presentation. Any questions, any comments, any discussion? Yes. A mic is coming to you.
I'll be loud. Your framework didn't include survivor care, but I think we know that is a given, and that's something we're going to make sure is part of our plan, because it's also part of prevention. But my question was regarding, we're Durham focused, but talking about collaboration and factors, what either are you, softball question, or you get to consider it, hard question, how optimistic are we all that state and federal can be partners in funding or legislation or effective enforcement? I see Satana shaking her head on the side.
Yeah, it's a really good and tough question. And yes, just to point out, in that slide, that's not a representative of every potential strategy. We're not limited to the strategies on that slide. But to this broader question of state and federal collaboration, at the end of the day, you know, you need, you know, and I think the mayor was very clear about this, you need to lead in this area. The state is not going to do it for you. The feds are certainly not going to do it. And my colleague Amber Parker is going to talk about this much more, which is once you have a very clearly defined local strategy, it's going to really clarify what you want and need from your state partners and from your federal partners. And you'll be much more effective in figuring out how to get resources from them and how to align with them and those things. So once you have, and I'll never forget it, when I was working for the White House on the National Forum on Youth Violence Prevention during the Obama years, we had an executive from Target who was a corporate partner, and he said something that really stuck with me. And he said, investors are attracted to infrastructure, meaning, and a plan is infrastructure. If you want to attract funding, you want a plan that folks can attach to. They want to have a very clear sense of direction. And so if we do that here in Durham, that's going to make it easier both for fundraising in terms of state, federal, but also private. So I hope that answers your question.
I had a question, and it's not like a gotcha, but I am genuinely curious. On your people-based strategy of stabilizing, then changing their thinking and addressing their trauma, and then getting them employment, I'm curious about how well that works, because a person that's high risk, financial stability is paramount, and just like in your work, have you seen that process be effective? And how do you, what's the word I'm looking for? How do you define stabilization without providing the ability for folks to support themselves? And I know that we're resource rich, but do we have enough resources? If I assume that stabilizing is like really housing, making sure that they have food and access, but a lot of folks not being able to work is a thing that puts them in bad situations. And I don't know if it's like a chicken or the egg. You can't hold down a good job without addressing your trauma, but you can't get, or you can't work and be able to address your trauma without being like financially stable.
Yeah, it's a really good question. It's not a gotcha question at all. And I think, first of all, with that slide, it's not literally that you do A, then B, then C, then D. These are 5 components. Maybe they flow roughly in that order, but they're often overlapping. The employment issue is a really interesting one. And, you know, the first thing is that there really is no clear empirical connection between just employment and violence reduction. So, you know, there was a famous anti-violence worker in LA who said, nothing stops a bullet like a job. And 2 or 3 years later, after he said that, he publicly withdrew that statement and said it was an oversimplification and it wasn't true. And the reality is that these individuals who we're talking about, these high-risk individuals, they have seen and experienced more trauma than most veterans from Iraq or Afghanistan. They have often never held a job. They don't have a steady source of income. They don't have a steady place to stay. They don't know where their next meal is coming from. And they have enemies who are actively looking for them, and if they find them, would kill them. That person is not job ready. And we got to stop acting like they're job ready. So what we need to do is think not sort of about generic employment. We need to think about subsidized employment. So for instance, there's a program in Boston and Baltimore called ROCA, and you're going to hear, the working group is going to hear from folks from ROCA. ROCA has a subsidized employment program where they immediately put someone on payroll, not a lot of money, and they start working these very menial jobs. They often do not do well in these meaningful jobs, and ROCA fires them, boom, because they didn't show up. They didn't, they were rude or disrespectful. 2 weeks later, they hire them back in the program, learning the lessons, also taking the CBT. It's that kind of process that is gonna work. So yes, employment matters, yes, income matters, but it's gonna need to be a much more resilient process than simply offering someone a job or simply getting them the GED. I really feel like you have to meet these folks where they're at, and if you don't, and you don't realize the situation they're in, you're really just setting them up for failure, and it's just one more disappointment. And so that's the reason we have that.
My question is a follow-up question to that. As a black male, 30 years old, a survivor of gun violence, seen people get shot and killed. My oldest brother was shot and killed. My dad was shot 16 times before I was even born, right? So I definitely feel like I'm the type of person who can talk about this. Plus, I'm a community violence intervention organizer with North Carolinians Against Gun Violence. So my question is a piggyback because I want us to kind of like zoom out for a second and kind of address the elephant in the room. And maybe some people don't see the elephant or feel the elephant. But what we're talking about is done on purpose. Like, the system is not broken. It's designed to have these inequities. The first street gangs of this country, right, I'm sure people have seen the gangs of New York, Irish, Italians, Jews. They didn't say, let's look at this individual. Let's look at that individual. Let's look at this individual. They said, there needs to be a structural change. And you know how the Irish, the Jews, and Italians, you know how they addressed that gang problem? They became white. They became white. They got resources, institutions, they literally addressed that. And now we have black and brown gangs, and they're not gonna give us those resources. They're not gonna give us, they may address it one person at a time, might do some CBT, might do some violence interruption, might have an OVP, might have all these things that are great, but we literally do a disservice if we don't go upstream. We have to keep saving these babies that are coming down the river by the best we can and have everybody in the room do that. But we are becoming hypocritical and becoming poverty pimps if we do not at least have a conversation on what it looks like to create a team to go upstream. And that's why I brought it up earlier, because we can have all these fancy conversations about how do you address those who are most marginalized. We will continue to have people with the same problems over and over and over again if we don't address the root causes. So again, I just want us to think about, in this plan for the next 3 days, how are we talking about that? Because if you need both and, it could be diunidal. It does not have to be dichotomous.
Yeah, I take your point. I respectfully disagree that it's hypocritical to focus on saving lives right now, particularly black and brown lives. But I do think that we can do both at the same time, but that those are two very different processes. One process involves, a very relentless approach on helping those who are most at risk right away. The other is a long-term advocacy approach, and and involves different actors and different strategies and different timeframes. And so, if you were to push those two together, you're going to get a mediocre strategy on both. And so, what we're trying to do is have a successful short-term strategy, and we can partner on the successful long-term strategy. But it is, it's too much to ask of, also, you're talking about something that implicates Durham, but is also statewide, nationwide, worldwide. And not all those people can be convened here. And so I would just ask you, respectfully, just be open to doing both. And that to see the inherent value in this as well as that. I'm not saying that broader conversation shouldn't take place. It should, and it needs to, and I support that conversation in my personal politics and personal life. But as an anti-violence expert, I can tell you that the way you're going to reduce violence and save lives right now is by focusing directly on the problem. Other questions, comments? Also perfectly appropriate to disagree, have these and have these conversations.
Hey, how you doing, Dr. Abbott? I had a question. This is when I was doing my research when I watched the December 17th, and it said something about the terrible cost of community gun violence. And it was saying how you can, add up each homicide cost from 10 to 19 million regarding like the criminal justice, medical, and other costs. And I was like, to myself, I said, this is my own opinion. How can you add up a person's life and say that that life would have been worth 10 to 19 million?
Yeah. Well,
Is it saying
I
that
did
the
it
criminal
again.
justice system was gonna lose out if the person didn't live because they targeting the black male? So the criminal justice would have lost a few million, and we have the medical lost a few million if this person would have lived. Why? How can you even say a person's life would be worth 10 to 19 million when a person's life is priceless?
Yeah, I think it's a great point. I mentioned that that it's impossible to quantify that today, and in my book, I mention a bunch of figures, but I also name a bunch of people, victims, perpetrators, and others. So I understand that this is about real people. The thing is that ultimately, what we're doing here, what the VRC is trying to do, what I try to do in this work broadly, is we're trying to solve the problem. And to solve the problem, you need a broader coalition of stakeholders than just those who are impacted. You don't need me to tell you how important this is. You know it, you've lived it. But not everybody in this room has, and not everybody in this broader room. And if I'm going to appeal not just to the folks who have direct experience, but the folks who have indirect experience and the folks who have no experience, and say, this is important, and we need your help to solve this, I need to speak to them both to their heart and to their mind. So depending on the audience, I'm going to be talking about this as an absolute moral obligation, which it is. But if I'm talking with a certain group who needs to hear it in terms of dollars and cents, and I'm saying the average citizen in Durham is paying for this with increased, insurance premiums. Everybody in Durham should care about this and raise taxes. So the point is that we need to reach people to understand that this is important, and we need to reach them however they're going to hear it. But I absolutely agree.
Have a homicide on a block, the property values in that area are going to get depressed in the following year. So is all this gun violence reduction is because we're getting all these new properties here and they don't want their taxes to go up?
No, the point is in the book, as I describe, is the gun violence that you're seeing in the city of Durham is suppressing property values, particularly in the most impacted areas. And so if we are successful, property values are going to rise. And that is going to create more income for the city. And then we need to channel that income back into those neighborhoods. And so basically, if this works, which I believe it will, you'll create a peace dividend. That money that you would have spent, all those costs of those very human tragedies, as you said, can be spent on other things. Pro-life things, pro-human things. And so that is the idea. But you're right that sometimes talking about the dollars and cents, it rubs people the wrong way. I'm a pragmatist. If I'm going to save lives and you need to hear it in terms of dollars and cents, that's the way I'm going to give it to you. If you need to hear it in terms of the moral life, talking about the specific victims. For me, a lot of this work started with Kim Odom, whose son was murdered, a few miles from my house in Boston. And in many ways, I kind of wrote the book Bleeding Out for her, and she's profiled in the book. So however it impacts you, I'm going to do that. All right. Thank you.
All right, we have come to the conclusion of the summit this morning, and I have a few closing remarks. First, I want to thank everyone. I want to thank everyone who has participated in this process up to this point over the last 6 months and more, showing up to a listening session, showing up to elected bodies, bringing forward proposals. There are so many different ways in which people have been involved in this. Holding your own listening session. So much work has happened. This is a continuing part of that story, but thank you for being involved. Thank you for coming today. Thank you for watching online. Thank you for watching this days after this fact, because this will be posted online, which leads to my second point. Everything that we have shared today will be posted and available publicly on the City of Durham's website, and we'll make sure we get it out to the county and others. All of the slides, all of this will be able to, you can watch it on YouTube. The third thing I want to say is something, I want to reiterate something that the city manager said in his remarks, that the goal of this today is not talking without any action. The goal of the summit, the goal of the working group that will be convening over the next 2.5 days is to come forward with actionable recommendations to which our elected bodies and these groups can be held accountable. Right? I want to underscore what you can expect. What you can expect at the end of these 3 days of this working group, this group, representing a variety of different expertise and lived experience across the City of Durham, will come forward with a set of actionable recommendations. Those things there will then be a public report out and a public vetting of those things. These will be presented in public spaces for additional conversation. But the goal is, as Thomas put in his presentation, that is happening within 60 days of the summit, that there is public dialogue, discussion, vetting, and action, a commitment toward a set of strategies. That is what we are asking to be held accountable, what you can expect of this group, that we are moving from ongoing listening to taking all of what we have discussed today, coming together as a group of leaders who care deeply about Durham to set a set of actionable recommendations that can help make a difference in what we've talked about today. That will be publicly reported out, public discussion. All that is coming over the next 2 months. I want to thank everyone who participated today, everyone who spoke, everyone who asked a question. I want to thank every person in on our working group who's going to be spending, the next 20 hours over the next 3 days working, learning together, and talking seriously about the things that we believe that we can do together in Durham to reduce violence and to save lives. That brings the summit to a formal end. We're adjourning now. For members of our working group, there will be lunch out in the hallway, and we will reconvene close to 1 o'clock to get started with the afternoon. Thank you all for coming. Yes, sorry, one other thing. We'll convene at 12:40. We'll convene at 12:40 as the working group. All right, thank you, and we'll be around if you have questions out in the hallway, but thank you for coming.